Well, good morning. My name is Joe Cressy, and I have the privilege of chairing the Board of Health. Our Board Secretary has confirmed that we have quorum, so I'm going to call meeting 36 of the Board of Health to order. A sincere welcome to everybody. I'd also like to let board members, staff, and members of the public know that clerks have informed us that at the May meeting, our Board of Health will be moving to a hybrid format. So the clerk's office has been working quite hard with City Council and standing committees and agencies, boards and corporations to enable hybrid meetings, not just for us, but members of the public as well. And so members of the board at the May meeting on May 16th will have the option of participating by video or in person at City Hall. And the same goes for members of the public, where they will have the option to participate either virtually or in person. And so more details will follow. And our team from clerks will be providing all the specifics in the lead up to it, but just so that members of the public and the board are ready, it will be a hybrid meeting at that point. Today's meeting is being held with directors and city staff participating by video conference. The public continues to participate electronically and can watch the meeting streamed live on youtube.com/Toronto City Council Live. Of course, I'd ask for everybody's patience with any delays and technical issues and express my gratitude in advance to our team from clerks to managing through this. We do have currently 3 registered public speakers. The clerks will connect all registered public speakers to the meeting by audio at their time. At this point, I would like to turn the floor over to Director Peter Wong to provide the land acknowledgement for today's meeting. Director Wong.
Thank you, Chair Cressy. So today, as we meet on this virtual platform, the good mind tells us that we would like to begin by acknowledging Indigenous peoples of all the lands that we call home. The land acknowledgement is an expression of gratitude for the land and one that has been practiced long before European settlers arrived on Turtle Island, also called North America. So on April 1st in the Vatican City, Pope Francis issued a historic apology to Canadian Indigenous peoples for the Roman Catholic Church's role in residential schools. This role sought to erase Indigenous culture, and a role where many children suffered abuse and were buried in unmarked graves. The Pope's apology is a first step towards acknowledging the truth of our past in order to right historical wrongs. But there's still much work to be done. There is much work to fulfill the Truth and Reconciliation's 94 calls to action. So today, as settlers in Toronto, let us continue to recognize the land that we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 and the Mississaugas of the Credit. Megwich, Chair Cressy.
Thank you, and Miigwech, Director Wong. Colleagues, at this time, as you know, I'd like to remind everybody that this will be my final meeting as Chair of the Board of Health. Our Vice Chair, Trustee Stephanie Donaldson, will assume the duties of acting chair when I formally depart later this month, and will assume those duties until the next Board of Health meeting in May, at which point it will be in your capable hands as the board to decide on the future chair role. I wanted to take a moment to recognize Councillor Wong Tam, but I don't think she's joined us here yet. So let's hold that off because this is also her final meeting. But let's wait until she's here later in the meeting because I do want to pay tribute to Councillor Wong Tam. But I understand, Dr. Davila, first, the floor is yours as you'd asked for a moment off the top.
Thank you, Mr. Chair. Yes, I would like to join you in recognizing Councillor Wong Tam, who has yet to join us, but I'll be happy to join you in recognizing and acknowledging her contributions when she is able to join us. But I would be remiss, I think we would all be remiss, if we didn't take a moment to acknowledge you, Chair Cressy, for all you have done over the past several years, and in particular over the past couple of years as we have navigated our way through what has truly been one of the most challenging periods, I think, for our city and certainly for us here at Toronto Public Health, and I imagine you, my colleagues here at the Board of Health. I'm going to try to get through this with some reasonable grace and decorum, but please forgive me in advance. You know, the last couple of years have been filled with challenge and difficult tasks for me. And this is no exception to that. It's always a difficult task to say goodbye to people who have meant a lot to us and who've done a lot for us. So with this, a little bit of a goodbye off the top. I know we have a meeting in front of us, but I did want to say a few words of goodbye and thank you to our chair, Councillor Joe Cressy. But how does one do this? How do you say goodbye to someone who, even before there was such a thing as COVID-19, worked incredibly hard in support of public health, and in that year leading up to COVID-19, worked hard to prevent local public health units, ours included, from suffering very, very deep cuts, major budget cuts that were proposed for us and for our colleagues around the province? How do you say goodbye to somebody who almost single-handedly influenced major changes on issues of public health relevance? The drug poisoning crisis and the Toronto drug strategy. Things like decriminalization, homelessness, paid sick leave. These are just a few of the items that our chair, Councillor Cressy, has contributed to. How does one say goodbye? How do I say goodbye to someone who so tirelessly and graciously has provided advice on public health communications and media relations throughout the course of this most challenging 2 years as we've navigated the pandemic? And this was advice that wasn't just provided, you know, in your usual 8:30 to 5 or, you know, business hours. We're talking about into the wee hours of the evening, early in the morning, you know, Friday, Saturday, Sunday. I mean, these days, these distinctions were arbitrary, but Joe was always available. You know, Joe, seriously, you were always there for us, for me to consult with on some very, very serious and challenging issues that we have faced over the last couple of years in particular. So I do want to say thank you for your wise counsel, for your always reliable advice, for always picking up the phone when I called, and for truly your steadfast devotion to public health. But how do you say goodbye? Well, I suppose first and foremost, you start off with a heartfelt thank you. You know, there have been so many occasions where we've said thank you, but I really do want you to know that we are deeply, deeply grateful to you, Joe. I also want to recognize the many challenging decisions that you supported us in making, the many anxious times you helped us through before there was a vaccine, the hard work that you helped lead us through together as we were dealing with a situation which really was unprecedented. So on top of saying thank you, I suppose part of saying goodbye is to say that we will miss you as a chair, as a collaborator, and ultimately as a friend to public health, and a friend to me personally. I think you also say goodbye by expressing how very happy we are for George Brown and their good fortune and the bright future we know they will have with you on their team. And I would also say how very happy I am and the whole team at Toronto Public Health is for your family, because we sincerely hope that as you embark on this new adventure with George Brown, that your hours will be less onerous and less burdensome, and that you will have more time to enjoy with Grace, with Jude, and the rest of your family. And then finally, I suppose the last thing I can say is that how else might we say goodbye? Well, you'll have to forgive me for doing it this way. This is a little complex here. But perhaps we say goodbye with a bit of a Public Health Leadership Award, in formal recognition of your contribution, Joe, to the health of all Toronto residents, acknowledgement of the strength you have brought to this position and to the unique challenges that faced us as a pandemic, and to the leadership you've provided, yes, during the pandemic, but most importantly on equity issues within the field of public health. So, Joe, this is not the regular way in which one administers an award, but I'm hoping you can see this here on the screen. Just a little token of our appreciation, Joe, for your leadership. You really are a COVID champion. So thank you from the bottom of our hearts, Joe, for everything you've done. When the meeting wraps up, I will, you don't just have to look at this on screen. I promise I will bring this to you in your office so that you can enjoy it. And hopefully, when you look at it, you'll think fondly of us, your friends here at the Board of Health and at Toronto Public Health.
Well, colleagues, and after that, I will simply say E rather than doctor, because that's how we refer to each other. Tremendous thank you to Davila, to you, and to members of the board. It has sincerely been the honor of my life to this point. For each other better, to build a healthier, fairer, and more just place for all. That is the work of public health.
This is the host to the chair. It appears that we're getting inconsistent audio from you. If I may ask you to turn off your camera, please. Thank you.
Well, thank you, Nahom. And what I will do is
I'm sorry, Joe, we still can't hear this banger of a speech you're giving. If you want to come to my office, I'm just down the hall. I'll mask up. You can have my space. We want to hear this, so get over here or something, because we can't hear you.
To the
colleagues, Nahom, do you have me now?
yes, we are getting consistent audio and video from you. We would also like to invite you to the committee room if that would make things a little easier. Thank you.
Okay, but just Nahom, can you confirm that you have consistent audio and video now again?
That is correct. We have consistent audio and video.
Okay. Well, colleagues, I have no idea where I left off. I express that sincerely I am very touched and grateful for those kind words, and to each and every one of you. It is not an exaggeration to tell you that it has been the absolute honor of my life to chair the Board of Health alongside all of you. And it's always been my view that our role as individuals but our role in public health is to care for each other better, to build a fairer, healthier, and more just society. And that work carries on. That work will be stewarded and continue to be stewarded in your strong hands and in the capable hands of E, Dr. Davila, who I but E more affectionately, and so a sincere thank you. With that, assuming you still have my audio, we can now proceed with the agenda, back to the agenda. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, could you raise your hand or unmute your mic and indicate the number? Looking around. Okay, seeing none. Next, we need a motion to confirm the minutes from our last board meeting just 3 weeks ago on March the 21st, 2022. I see that's been moved by Director Bowery. All those in favor? Opposed, if any? All right, now as we go to the agenda run through, colleagues, I'd like to propose that item 36.1, which is the response to COVID update, and item 36.2, which is the TO supports COVID equity action plan update. I'd like to propose we deal with those together. There's a presentation on each, and given that they both relate to COVID, I think it's useful for us to have them together. Of course, we will provide time for multiple rounds of questions because we want to have as much time as board members as collectively we need, but I think it would be helpful if we had presentations on both of those before hearing from speakers and moving it into committee. And so, board members, are we comfortable with that approach? I saw a thumbs up from Councillor Perks. Okay. So with that, then, to run through as we go through the agenda, item HL 36.1, response to COVID, there is a presentation as well as deputation, so that's held down. Item HL 36.2, TO supports COVID-19 equity action plan update. We do have a presentation, and we will be dealing with those first two items together, so that will be held down. Item HL 36.3, health impacts of the COVID-19 pandemic on children and youth. There is not a presentation on this. Would anybody like to hold down this item? That's being held down. Thank you, Trustee Donaldson. Item HL 36.4, climate change and the role of public health. Would anybody like to hold this item down? Okay, seeing none, I will move the recommendations in front of us. All those in favor? Opposed, if any, that carries. And then item HL 36.5, this is Two-Spirit, Lesbian, Gay, Bisexual, Transgender, and Queer Drug Strategy. This was a request from the advisory committee that has come through council. Would anybody like to hold that item down?
No,
Okay.
but I'd be happy to move it, Chair. It's Councillor Wong Tam.
Oh, Councillor, great to have you here. Moved by Councillor Wong Tam. All those in favor? Opposed, if any, carried. And before we begin the presentations, Councillor Wong Tam, I hope you'll let us indulge you for a moment, which is, we know that this is your last Board of Health meeting, that you are resigning as a member of council and the board for a new grand adventure. And if I might just to take advantage to express on behalf of the board the deepest and most sincere thank you possible. Councillor, you have been an absolute rock on this board and a relentless, just an utterly relentless advocate, voice, conscience for us when it comes to equity at all times in Board of Health matters and the governance of TPH. And I know, I mean, I speak for this personally, but I know others probably feel that you've also been a near and dear friend. And so, Kristen, to get rid of the formalities, Kristen, a heartfelt thank you. And we wish you the very, very, very best on your next adventure. And I know Eileen also wishes to jump in as well. If I could turn the floor over to her.
Thank you, Mr. Chair, and good morning, Councillor Wong Tam. I also wanted to take a few minutes, and I thank the board for their indulgence yet again for another few minutes, but this time to acknowledge you, Councillor Wong Tam, and your many, many contributions over the years towards advancing health status and reducing inequities in health status here in the city of Toronto since 2010, if I've got my dates right. You have been truly a wonderful collaborator and major advocate for improving health status in the city. And I just wanted to personally thank you on behalf of the entire team at Toronto Public Health for all you have done to advance public health. I would just note that, I look at the list of things that you have contributed to and the many, many ways in which you have advanced health in this city, whether it was work on park revitalization, street redesign, tenant issues, providing a voice, being a voice and a champion for those who don't always get heard or listened to. You have done remarkable work to advance health in this city. And so for that, we thank you. The entire team at Toronto Public Health thanks you. And we wish you all the very, very best, because we know that, you are going from championing these issues here, hopefully to championing these issues on another bigger stage. But we have no doubt that you will make major contributions as you move on. I once again find myself in the position of saying that we do have a little acknowledgement for you from the team at Toronto Public Health. I will come down to your office and bring this to you personally once we wrap up this meeting, but just wanted to say thank you very, very much for all your leadership and your championship of issues in public health here in the city over the last several years. Thank you, Mr. Chair.
Thank you.
Kristen, do you want to say a few words off the top? We'd hate to let this meeting pass without putting the floor straight to you. If you have any final words.
Thank you, Chair. Thank you, Eileen. Thank you, E. And I mean, quite honestly, it's a very moving time for me emotionally, just because these conversations are never easy. But I also want to just extend my gratitude for the opportunity to have served with all of you. This has been, of course, like Joe has said, the greatest honor of one's life is to hold public office and to give one over to public service. I think what I would offer all of you is that there are many people in our city who continue to be left behind. You know this, and I know you know this because it's demonstrated through your words, through your actions, and also through the heart-to-heart conversations I've had with many of you. I really value the opportunity to learn and grow. I think that each and every single one of us bring a very unique perspective to the work that's here at the Board of Health. As a member of the 2S LGBT community, I think, Dr. Davila, you could probably recognize that I have tried to, at the very minimum, brought the needs of the community to the board on many occasions. The one thing that I would encourage everyone to continue doing, and excuse me, this is tough for me because whether it's investments in the aid service sector or investments and supports for people living with mental health untreated, or investments in services for the trans and non-binary community, I know that public health plays a leading role. And I am very mindful that there's much more to do now than ever before, largely because what we've seen with respect to the impacts of the pandemic. So I encourage all of you to continue to do the fantastic and remarkable life-affirming work that you do. And I encourage you to bring in all those people who are outside the tent into the tent. And I know you will do it because you've always demonstrated that it can be done. And every life matters, and every individual matters. Eileen and Joe, thank you for the ongoing friendship. To all of you, I know I'm not the only one seeking a run at the political stage. To my friends on the board, Ida and Sue, although we are a part of different political parties, I look forward to hopefully working with you collaboratively at Queen's Park so we can address the issues that Torontonians face and we can advance their betterment, health, mental health, and overall well-being. Thank you very much.
Kristen, the city is better for you, and we truly are on this board, so thank you for that. Colleagues, we now dive into the work. So we will return then to our first item, which is item HL 36.1, response to COVID. There is a detailed presentation here from Dr. Davila. Members of the board, you had email circulated copy from the clerks this morning if you want to follow along. And then immediately after, we will receive the presentation from Aderonke Akonde from Social Development and Finance Administration, as well as Dr. Nashikit Lamptey, our Deputy Medical Officer of Health, on the Equity Action Plan before hearing from speakers. So, Dr. Davila, I will turn the floor over to you for the presentation. And again, members of the board, you have an electronic copy if you wish to follow along. Over to you, Doctor.
Thank you, Mr. Chair, and good morning, members of the board. I will thank in advance my colleague Dylan Feist, who will be advancing the slides. And if I may, to the members of the board, I realize you have just received the presentation this morning. I do apologize that you were not able to receive it earlier. I will, beg your forgiveness. It has been only 3 weeks since we were last gathered around as the Board of Health. So it has been a very, very busy time. And again, we seek to keep you informed as best we can, but of course, there are all the challenges of managing this very interesting time in which we find ourselves. And I'm about to walk you through a presentation to take you through what has happened and where we're going, but in particular, what has happened over the last couple of weeks since we last met. So if we can, we'll go right into the presentation. Moving to the next slide, we're going to start off, as we always do in these presentations, with a status update as to where we are with the COVID-19 pandemic at this point in time. The next slide gives you a sense as to how we are doing by way of the key indicators. And not unanticipated, and certainly as alluded to and discussed at the last Board of Health meeting just a few weeks ago, we are seeing an increase in COVID-19 activity. I won't go through all of the indicators here, but suffice it to say that indeed we are seeing an increase in COVID-19 activity as reflected certainly across the top half of the slide, those indicators regarding the virus spread and containment. I'll call your attention to a couple of items here. The 7-day moving average on new COVID-19 cases is now sitting at 508. When we last met, this was about half that, at roughly 245. We are seeing an increase in the weekly incidence rate relative to the last time we met, and certainly an increase with respect to percent positivity. You'll see now that that figure sits at 14.2. When we last met, it was 11.6. The lower half of the slide, or the lower portion of the slide, which has the indicators regarding health system capacity, interestingly is holding relatively steady, and in some cases has actually gone down since we last met. You'll note that we have, as health system capacity indicators right now, the ICU bed occupancy rate and the acute bed occupancy rate on the left and middle part of the bottom aspect of the slide, and on the bottom right, COVID-19 related critical illness or ICU occupancy rates. With respect to the ICU bed occupancy rate, you can see it's now sitting at 68%. When we met a few weeks ago, it was 71%. So we see a decline there. The acute bed occupancy rate currently sitting at 94%. The last time we met, sitting at 96%, slight decline there as well. And then the COVID-19 ICU occupancy rate now sitting at 7.5%. The last time we met, this was sitting at a little over 10%. So again, we're seeing declines at this point in time in respect of these health system indicators compared to what I showed you the last time we met. Turning to the next slide, just a little more detail in respect of hospitalizations, and in particular on the other more serious outcomes of COVID infection. Here on this slide, you see that we have a depiction of severe outcomes since the beginning of the pandemic, showing all 5 waves, with the most recent complete wave as depicted in January 2022. What you can see here in this figure is that hospital occupancy and new hospitalizations have declined significantly since that peak in January. But as you can see towards the very right-hand side of the slide, the number of new hospitalizations is starting to increase. And you can see that green starting to go up on the right-hand side of the slide. I would also point out to you that while there were, if you look over time, just at the course of the entire pandemic and severe outcomes over the course of the 5 full waves that we have depicted here, there were fewer hospitalizations during the Omicron surge compared to that which we saw, say, for example, in wave 3 last spring. And this is likely due to a combination of things, most notably one, the fact that Omicron seems to be a less severe variant in terms of producing severe outcomes or serious outcomes like hospitalization. And of course, in large part due to vaccination, right? A very different situation we find ourselves compared to what we were facing in spring of 2021. Again, I would like to just point out that this really does demonstrate the importance of the action we have taken and the knowledge and tools that we now have, and how we put those tools to good use in partnership with our many partners and collaborators as part of the COVID response. Turning to the next slide, here we see more evidence of the positive impact of our collective response throughout the pandemic. And, as I mentioned earlier this morning, this is a credit, I think, to you as a board, and in particular, if I may, to our chair, Councillor Cressy, who has relentlessly championed actions and the use of our data that we have in respect of making sure that our pandemic response was increasingly addressing the issues of inequities. So as you know, Toronto Public Health has been collecting and sharing data on reported COVID-19 infection by race and income groups since the summer of 2020. And yes, we have used these findings to guide policy and programs aimed at reducing inequities throughout the entire pandemic. And what we are putting here in front of you today as members of the board is that, this work actually has paid off. As you can see here, over the course of the time that we were collecting these data and using them in partnership with those who we were collaborating with, community partners, healthcare partners, city partners, we have seen that we have been effective in terms of reducing the disparity between racialized individuals and those self-described as white. We see the decrease here in the impact of COVID-19 cases by racial group. And these are data for between June 2020 and November 2021. Again, a testament to the optimal use of data to inform a pandemic response, to ensure that that response is more equitable. Turning to the next slide, we see another variation here, and again, another example of using the data and the knowledge that we have to better achieve the kinds of outcomes that we together want to see in our city. Mitigating the impact of COVID-19, but ensuring that this is done in an equitable way. Here we see similar findings demonstrating an improvement using the data and knowledge that we have in respect of the impact, I should say, of COVID-19, reducing the disparities between those living with lower income and those who who enjoy higher income. We see that that disparity was also reduced over time as a result of the concerted efforts, yes, by the team here at Toronto Public Health, but it could not have been done without the partnership of the many other people and agencies with whom we collaborate as part of the COVID response. City partners, community partners, healthcare partners, all playing a fundamental role in addressing the situation on the ground and achieving this reduction in inequity that was seen earlier in the pandemic and eventually addressed over time. Now, I should point out that there have been some changes to testing guidance and eligibility that were put into place by the province last year. And this, unfortunately, means that access to data on this front for us has changed. We are, of course, continuing to collect socio-demographic data in those areas where we have control, notably the Toronto Voluntary Isolation Centre and as well our vaccine clinics. But with the changes in provincial testing guidance and the data that are collected there as a result, we actually are getting differential access to data and are working with our partners to demonstrate our continued commitment. Just as you spoke of, Councillor Wong-Tam, earlier in this meeting, we want to ensure that we are staying mindful and aware of the differential impact that COVID has on different subsegments of our population, and that we're ensuring a more equitable response and more equitable outcomes as best we can. Yes, in respect of the COVID response, but this applies as well to health issues beyond the COVID response. And I think you will see what we're trying to get at upcoming later in this presentation. You'll see that we have a recommendation that speaks specifically to this, ensuring that we have data and that appropriate data linkages are made so as to provide, yes, improved outcomes in health overall for the residents of Toronto, whether it's in respect of COVID or other health issues, but as well seeking to ensure that health is improved in the city in an equitable fashion. Turning to the next slide, we are now in the section of the report that speaks to reporting in the new phase of the pandemic in which we find ourselves. Next slide. I've mentioned this before in public appearances, and in fact, I mentioned this at the board meeting just a few weeks ago. We are in a different phase of the pandemic at this point in time. We have seen the provincial government ease restrictions. There are some changes in the availability of data, and we are increasingly trying to establish a place whereby we are both managing COVID response and at the same time in as safe a way as possible, increasing access to other aspects of life, other activities that are also crucial to the maintenance and creation of a good, healthy community. And so it is important to reflect that we are in a changing situation in the pandemic. We are still very much in the pandemic, but we are in a changing landscape as described here on the slide. So with that, we feel that it is important that we think about updating our dashboard to reflect, one, the changing availability of what data there are for us to report on and the accuracy of those data sources, and perhaps more importantly, to expand the suite of indicators so that our public and you, the members of the board, have a more meaningful understanding of what the current epidemiology is and what that means for us as a city. So in particular, you've heard me speak about some of these, but I'm elaborating a little bit further today for your benefit. The kinds of indicators that we're expanding to include are going to be things like wastewater. We know that given the changes to testing as affected by the province, having wastewater is important as an early indicator of COVID-19 activity. We also recognize that percent positivity which has previously been based on individual at an individual level, is we are now proposing to report more on a test basis level as that data are more accurate and available to us. We're also looking to expand to include things on our dashboard, again, to inform the public and you, to include things like the 7-day moving average on new ICU admissions. This is an important indicator of disease severity. Looking at, for example, the vaccination rate and the hospitalization rate in priority neighborhoods. These are the kinds of things that we know need to be reflected in our dashboard at this point in the pandemic, and to help inform our public overall as to how best to conduct themselves given where we are in the pandemic, which is very different from where we were certainly a year ago, and most definitely very different from where we were 2 years ago at the very outset of the pandemic. Turning to the next slide. We also know that while traditionally, especially very early on in the pandemic, much of the reporting was done on a daily basis, we are now at a point where what is more meaningful is really around the reporting of trends, rather than focusing on day-to-day changes. These day-to-day fluctuations are much less meaningful than they were, say, for example, in early 2020. So what we are proposing is to adjust our reporting cycles to reflect that we are in this different point in the pandemic, and to ensure that you are getting data that is relevant and actually reflects the rate at which meaningful information is available. So over and above updating content to reflect the current times, we're updating the timing of our reporting. And again, the purpose of this is to reflect the rate at which meaningful information is available. So if we go through these slides, what is being proposed at this time, and again, lots of work still being done on this, is, and I'm just going to ask Dylan to advance the slide, we're saying that on Tuesdays, our proposal is to report on case counts, active outbreaks, and hospitalizations and deaths. And with one more click of the slide, we'll see what we're reporting to, proposing to report on Fridays, which will include case counts, active outbreaks, and vaccine data. Again, just really focused on making sure that we're following trends and providing information to you and the broader public at a rate that is consistent with the rate with which we get meaningful data that actually has an impact on what people need to know and can do as they seek to navigate our changing environment. Next slide. As you'll see here, a little bit further by way of information on how we propose to report on trends. This is, again, just a sample, a mock-up, as you'll note at the bottom of the slide for demonstration purposes, giving you a sense as to how we're planning to update our dashboard so that it is meaningful for those who seek information through it. This is an example of how our current Fearless data team proposes to provide information in respect of wastewater surveillance. You'll see that, yes, we do have a number of different sites within the city, wastewater treatment plants, each with their own specific wastewater signal. These, again, are mock-ups. Just to be clear, when I look at our most recent data, just to inform the board in respect of what's being seen at the different wastewater sites, the most recent data suggests that Ashbridges Bay, which is our largest wastewater treatment plant serving about half of Toronto's population, showed no change, and an increase in the 3 other sites, Highland Creek, Humber, and North Toronto. Again, the data here that you're seeing on the slide is just a mock-up. What I've just delivered to you verbally is, in fact, the most current data that we have. But the point here was to provide you with a bit of a a sample as to what the future dashboard may look like and the kind of information we're seeking to convey to the public at this point in the pandemic. So on to the next section, we're going to be turning to a discussion on COVID-19 vaccination. Next slide. Vaccination is certainly one of the key tools that has changed, how we can approach this pandemic at this point in time. It is, probably the best tool we have, but I would remind us that it is just one of the tools that we have that can mitigate the current Omicron wave. We do know that increased COVID-19 activity currently observed in the community is being driven by the Omicron BA.2 variant, about which we've heard quite a bit over the last several weeks now. We can also tell you, and you'll see we've got some slides to help depict this, that residents who are up to date in respect of vaccine, particularly those who have at least 3 doses of vaccine on board, have the lowest rates of serious outcomes compared to individuals with fewer than 3 doses. This is especially true the older you are, as the older individuals in our community are at higher risk of serious outcomes, as well as those who are immune compromised. And I would just remind members of the board that given increased COVID-19 activity, and this is of course information for the public as well, using the layers of protection that we have, the tools that we have acquired, the knowledge we have acquired over the last couple of years now, the use of these tools and this knowledge is absolutely essential to keeping ourselves and others safe. And as you can see here, these are going to ring familiar to those of you on the board. This is about getting vaccinated, reducing contacts, wearing a well-fitted, high-quality mask, staying home when sick, and increasingly accessing treatment. Another tool, which is relatively new, if I can, over the course of this pandemic, and certainly offers a great deal of promise in respect of mitigation of the impact of COVID-19. Turning to the next slide, not a significant change, so I won't linger on this for very long, other than to say that those of us here at Toronto Public Health and all of our vaccination partners continue to work towards vaccine coverage and driving this up, recognizing the benefit that vaccine has. And, as you saw from an earlier slide, we can see that in our hospitalization rates, that as vaccine has become more available, we've actually seen less by way of serious outcomes. So we're continuing to monitor vaccine coverage in the city. We are seeing increases slowly but surely with all the efforts that we put into place. And as you can see here, we're almost at 70% of individuals age 60 and older who've received a 3rd dose. So this is an ongoing effort, certainly for us at Toronto Public Health and for our other vaccination partners throughout the city. Next slide. Our efforts are paying off. You first had a preview of this at the board meeting 3 weeks ago. We continue to be a leader in vaccine coverage amongst major cities. You'll note in particular on the right-hand side of the slide, our 2nd dose coverage has continued to increase. It is now at 82%. It was at 81% when I presented to you just a few short weeks ago. And again, I cannot thank the team at Toronto Public Health and our vaccination partners enough for their remarkable work in this regard. This has actually helped get us to this point and will continue to be important as we together navigate the ongoing pandemic. Almost 7 million doses delivered in 15 months. I did not think, prior to this pandemic, I did not think that this would have been possible. But as I mentioned to you last time, thanks to the efforts of so many in Toronto Public Health and our vaccination partners, community partners, healthcare partners, pharmacy, primary care, truly together we have made the impossible possible. Next slide. I had mentioned earlier in this conversation that there is a clear difference that we've seen. Unvaccinated individuals had the highest rates of hospitalization during the Omicron wave. This is depicted for you here. I cannot emphasize this enough, and this is not unique to Toronto. Vaccination makes a difference, and it is because of this that you will continue to see us at Toronto Public Health and our vaccine partners continue to make every effort to increase vaccination across the city, making sure that everybody has access to the doses for which they are eligible. And it is with that in mind that we're going to the next slide, and you'll see that we're continuing to promote the uptake of third doses. We've seen the benefit. It makes a huge difference in respect of severe outcomes. Hence, we at Toronto Public Health, along with our partners, have launched the third dose drive, really focused on getting residents their third COVID-19 vaccine dose. It is a multi-channel effort and is supported by very specific outreach, direct outreach to about 40,000 people in 13 neighborhoods where we know there are challenges in respect of third dose uptake. So again, it is about making sure that the entire city has access, but with very specific regard to making sure that those for whom vaccine access and uptake has been a challenge in the past, that their needs are very specifically met, and every effort made to ensure that they are taking advantage of the protective benefit of vaccine for themselves and for those around them. Turning to the next slide, the provincial government announced last week expanded eligibility for fourth doses. So this is likely something that members of the board had heard about. Expansion of eligibility for fourth doses of COVID-19 vaccine to individuals aged 60 and older. The official recommendation from the province in respect of this expanded eligibility is an interval of 5 months between the third and fourth dose. But they have also indicated, the province has also indicated that that interval may be as short as 3 months. And as depicted on this slide, outside of those aged 60 and older, fourth dose eligibility has also been provided by the province under their policy to First Nation, Inuit, and Métis individuals and their non-Indigenous household members who are aged 18 years and older. So this is the latest aspect of our vaccination campaign. And of course, this too is being incorporated into our ongoing work with our vaccination partners. Next slide. Giving you a bit of a flavor on how we use our data to plan. You can see here that we have taken the data that we have in respect of those who are eligible or anticipated to be eligible shortly for that fourth dose to understand what the demand might be in respect of fourth doses. So here on this slide, you see that we've got a depiction of the residents aged 60 years of age and older who are eligible by fourth dose over time. This is presuming a 5-month interval between the third and fourth dose. This is just to give you a little bit of a flavor as to how we use our data. One, to understand who is eligible and what the scope of the population that we have to serve looks like. And as such, it's used to help us plan what the next steps are. How do we use our resources to be effective and to ensure that people are afforded the opportunity to get that protective benefit of vaccine in as timely a fashion as is possible. So on to the next slide. We are now towards the end of my presentation, but I would like to walk the board through some of the recommendations. Next slide, please, Dylan. So we have a few recommendations, or I have a few recommendations for the board's consideration, and I would hope approval. As you've heard me speak to, we are at a point in the pandemic where, based on our assessment of the situation, further guidance and resources are needed to support our community and individuals within our community in assessing their risk from COVID-19 and making good decisions and taking protective action for themselves and those around them. Hence, we have a few recommendations here, the first two of which are shown on this slide. I will walk the board through these, not in great detail, and of course we'll be happy to answer questions when we get to that point of the meeting. But the first is really focused on ensuring that we at Toronto Public Health, and of course the province, who has a lot of latitude, in fact more latitude on these issues, can help provide focused guidance to the public so that they are aware of how best to use layers of protection. And in particular, in this recommendation, we're seeking additional support or suggesting that additional support should be provided. Yes, by us at the local level, and importantly, by our colleagues at the provincial level, to those who are at greatest risk for severe outcomes from COVID-19. This is going to include, for example, immune-compromised individuals. These individuals should, courtesy of the provincial health system, be provided priority access to testing, better access to personal protective equipment, and other resources to help support them engage in all the aspects of life that we know contribute to health in as safe a way as is possible, given that we are still in the midst of a pandemic. So that's effectively the substance of recommendation 1. With respect to recommendation 2, here we are seeking your support in exploring innovative and ways that are accessible to really use our data to communicate with the public, again, with the purpose of informing informed decisions, good decisions in terms of mitigating risk of COVID-19 to themselves and those around them. Next slide. This is also on the theme of providing COVID-19 guidance and support. This recommendation is for the board to request that the Ministry of Health and Ontario Health, as our provincial partners, work with us and other relevant stakeholders to facilitate access to and increase appropriate uptake of COVID-19 treatments. And you'll see that we've called out a few particular elements that are important in facilitating this access and in increasing uptake of COVID-19 treatments. An information campaign to support healthcare providers and the public around the availability of treatment, because we do have remarkable tools available to us that need to be better taken up, along with our efforts to promote increased uptake of vaccine. Healthcare providers and the public also need resources to help support them to use the available treatments, not just to be informed, but to actually use the available treatments to protect our community from COVID-19. And finally, we recommend that the existing remarkable community vaccine infrastructure that has been established over the course of the vaccination campaign be used and leveraged in a way to support effective, equitable access to COVID-19 treatment. So those are the first 3 recommendations that I am putting in front of the board for their endorsement. And these are in respect of providing COVID-19 guidance and support as we navigate this next phase of the pandemic. Next slide. We have also 2 further recommendations. These ones focused on advocating for expanded socio-demographic data collection. So as I mentioned earlier, we have used socio-demographic data to good effect, not only as part of the COVID response overall, but in a very specific way to reduce inequities in different populations within our community. We have been a leader in this regard. And I would strongly recommend to the board that you call on the Ministry of Health, the province of Ontario, to explore with stakeholders and communities the implementation of methods to more systematically collect socio-demographic data, including race, within provincial health services. We're also asking that, for example, better linkages between existing census data and health data would also make a difference, not only in respect of responding to COVID-19 and mitigating its impact in an equitable way, but there is value here on an ongoing basis to address health issues beyond COVID-19 and to take us beyond the pandemic. So hence we have recommendation 4 specific to that, and the 5th recommendation asking that, presuming that the board sees fit to approve and endorse this recommendation, that we forward the recommendation to all boards of health in the province and as well to the Association of Local Public Health Agencies. So just a few words. I'm at the final few minutes, if you will. Dylan, on to the next slide. Again, at the end of every presentation I have done over the past couple of years now, just a few words in recognition of our public health workforce. I'm going to move us on to the next slide. Last week was the inaugural Canadian Public Health Week, and a mayoral declaration was issued recognizing Canadian Public Health Week, and the Toronto sign and the CN Tower were lit up in recognition of Canadian Public Health Week. Chair Cressy, members of the board, today marks 807 days since the first case of COVID-19 was identified in this city. And as I did a little bit of calculating here on the side, it's actually exactly 825 days since we issued a news release in early January of 2020 about an emerging pneumonia that was not yet fully understood, discovered and announced in China. So 807 days since that first case of COVID was identified here in Toronto, now 825 days since we issued our first news release on this issue to the people of Toronto. And it has been a very, very challenging 800 plus days for all of us at Toronto Public Health. But very briefly, members of the board, I just want to ensure that you are aware of the remarkable efforts that have been taken on, the remarkable efforts and work that has been put in and day out by the team at Toronto Public Health. And yes, by our many partners who have linked arms with us over the course of these 800 plus days and have worked with us to effect the best response we are able to provide to the residents of Toronto. The team is tired. They are weary. I see it on the faces of my colleagues on screens almost every single day. But I can tell you that they remain uncowed and they remain steadfast in their desire to continue to provide as effective a response as is humanly possible at this point in time. So with that, I just want to thank the entire team at Toronto Public Health for their continued efforts, for their continued passion, and for all that they continue to do. 800 plus days in, we are still very much in the midst of a pandemic, so there is much more that we have in front of us. But everything that we have achieved has been because of this remarkable team, and all that is in front of us, I know, is a credit truly to the very professional, very caring, truly remarkable team at Toronto Public Health. So thank you for indulging me yet again, Chair Cressy and members of the Board of Health. Mr. Chair, that wraps up my presentation, and I will now turn the microphone back to you.
Well, thank you, Doctor. And colleagues, we're dealing with both 36.1 and 36.2, the Equity Action Plan update, concurrently. So we're now going to have a presentation from Adirronke Conde from Social Development and Finance Administration, as well as Dr. Nakashi Lamptey, our Deputy Medical Officer of Health. After this presentation, we'll move to our three speakers on this item before committee. So Adirronke and Dr. Lamptey, can I pass the floor to you?
very much, Chair Cressy and other board members. It's our pleasure to be here, and let me extend my best wishes sincerely to you, Chair Cressy, and other members of the board who are departing for other adventures. You've truly driven us at Toronto Public Health to be your very best, and I hope that you leave with some pride in the impact that you've had. And a demonstration of that impact is the topic that Ms. Akande and I are going to speak about today, which is the work that's been done as part of the COVID-19 Equity Action Plan. And with that, we'll go to our first slide, please. The COVID-19 pandemic has exacerbated long-standing systemic, social, and health inequities that we're aware of in our city. We have seen during this pandemic that equity-deserving populations have experienced higher rates of COVID-19 illness, hospitalization, and unfortunately death and loss. Equity-deserving populations have experienced higher rates of emotional trauma and mental health challenges during the pandemic, and the COVID pandemic compounded inequities in terms of economic exclusion due to job loss and financial insecurity. And our population continues to experience inequities related to racism, housing precarity, food insecurity, and social isolation. The purpose of this presentation is to update the board on strategies implemented by the City of Toronto to support Torontonians disproportionately impacted by COVID-19. This presentation is going to focus on TO supports and the vaccine engagement teams, and it talks about the outputs and outcomes of these initiatives and how learnings can be used to inform future work. We would also like to highlight that it will be important to continue to prioritize the health and social needs of equity-deserving populations, and therefore recovery plans must also account for the potential need to adapt to changing public health conditions, such as future variants, vaccine developments, and other therapeutics available to address COVID-19. If we can go to the next slide, please. Building on Dr. Davila's presentation, we have made tremendous progress in COVID-19 vaccination in our city. You do not get to the global results that she highlighted without beginning with deep local impact. Dr. Davila also mentions our mission is to improve health status and reduce health inequities. And this image, or series of images here, is a demonstration of how we continue to drive for both as it relates to COVID vaccination in the city. This graph shows the 35 neighborhoods prioritized for intense hyperlocal vaccination activity due to the public health needs identified by information such as the Wave 2 COVID case and hospitalization rates, percent of people aged 65 and older who had at least one vaccine dose, percentage of people that identify as racialized, and percentage of residents living below the low-income measure and in crowded housing. So when that information was grouped together into an index, that was what shaped the identification of these 35 priority neighborhoods. And then we used this information to concentrate the efforts of vaccination partners, and we made a difference. Not only did we see increased uptake of COVID vaccine across the city, but the gap between uptake in priority neighborhoods and the rest of the city narrowed, as we can see here. The priority neighborhoods increased their uptake from June to April. This was due to hard, concerted, concentrated work across many agencies, people, and teams around the city. And it did include the outreach, connection, and care demonstrated by the community ambassadors who were in operation during this period. And with that, I'm going to turn it over to my colleague, Ms. Akande. Next slide, please.
Very much. Good morning, everyone. So I'm going to speak to the TO support and the work that's happened as well in terms of the vaccine engagement to date. So TO supports the COVID-19 Equity Action Plan, It's really a guiding framework of equity measures that were developed in March 2020, so early days of the pandemic, to support Torontonians disproportionately impacted by COVID-19. This plan actually was brought to the Board of Health in December of 2020 and endorsed by the board. And I would say over time, the plan has evolved, really shifting with new information, building on new partnerships, and of course, responding as pandemic conditions have changed. So this slide illustrates some of the initiatives connected with TO supports. The first I'll mention is the investment fund. This funding stream, which is now concluded, provided $9.7 million in emergency funding to support vulnerable individuals across the city, really focusing on key equity issues with the funding. So looking at food access, mental health, housing challenges, and homelessness as those funds. A mental health support strategy was developed, enabling streamlined access to mental health services at no cost, in partnership with 24 community-based mental health service agencies across the city. And in the roughly a year, 2 years that this has operated since April 2020, over 280,000 people have received direct mental health support or referrals through the strategy. They also mounted a food response, an emergency food response with a range of interventions to deal with the emergent needs. So whether that was funding to agencies already providing food supports or establishing emergency food banks at 12 Toronto Public Library locations, distributing prepared meals, or repurposing student grants to support over 60,000 families when schools closed down through grocery cards. A number of measures were there to support Torontonians. We also worked in collaboration with United Way to establish a community coordination plan, really infrastructure on the ground to help support the communication and coordination of what is now more than 400 community-based agencies working across 10 geographic clusters and 2 non-geographic clusters to support vulnerable Torontonians. This infrastructure has really been key and enabled and supported the hyper-local response to the pandemic, which continues to this day, and has continued to allow for agile community-based responses to emerging needs and service gaps. Building on the community coordination plan, we had an equity action plan, which launched in June 2020, and really leveraged the networks of the community coordination plan to bring resources forward. Almost $8.3 million was distributed to community and health service agencies through the plan, again, supporting direct action and need on the ground. So whether that was targeted outreach, social supports, mental health, or the provision of personal protective equipment that was so needed in the pandemic. And over 540 vulnerable community members were supported through this action. And I'll go to the next slide. Thank you. So vaccine engagement teams have been mobilized and are a key component of the city's vaccination program, really helping to support Torontonians, particularly those who have been particularly impacted as a result of historic or ongoing systemic inequities. The work of these teams really build on the TO support's equity measures. They operate through 17 geographic and population-based consortiums, working with over 200 health, community, and faith-based organizations, leveraging the community expertise and partnerships with those groups to facilitate and promote vaccine uptake. And some of the key elements of the work are noted in the slide. $9.5 million has been distributed since March 2021 to support this work, and that includes $1 million provided to Indigenous organizations to self-determine engagement strategies. The funds really support place-based and population-specific approaches to drive uptake of vaccination and to reduce barriers. Over 600 community ambassadors have been mobilized, providing outreach in a range of ways, whether that's door-to-door or in public spaces. And through this work, over 1.5 million Torontonians have been engaged, either by the vaccine engagement teams or the community ambassadors. And next slide. Oh, sorry, just advance to the next slide. Thank you. So I'll just speak a bit about community ambassadors. These community members, these Torontonians, are really critical and an effective part of our engagement approach. Ambassadors are trusted peers in their community, and they bring invaluable insights and lived experience regarding the barriers that others may face. They reflect the diversity of Toronto's equity-deserving groups, whether that's in language or culture or race. And these ambassadors are really the cornerstone of the success of the vaccine engagement strategy. In 2021, ambassadors spent over 46,000 hours conducting outreach in communities across the city to build vaccine confidence, to provide access to resources, and amplify public health messaging across the networks. Speaking a combined 43 languages, ambassadors also use a range of outreach activities to engage the community, and a number of ways, including door-to-door or direct phone calls. So that really a number of efforts. And the slide illustrates some of the outcomes and achievements of the work of this group, in addition to the great number of people that they have been able to reach through their efforts. Next slide. And of course, monitoring and evaluating impact is a key piece of the work. Regular reporting and monitoring throughout the implementation of this work has really enabled the city and partners to evolve in response to trends and gaps and emerging issues. And the insights from this regular reporting and monitoring have enabled the city and the partners to adapt offerings and change approaches over time. Evaluation of the vaccine engagement team initiative is also being conducted. Preliminary findings were presented in December 2020 to the Board of Health, and these indicated essentially at a high level that vaccine engagement teams are responsive and an effective model for place-based strategic planning, hyperlocal engagement, and collaboration. And we will be back to the Board of Health in May with final evaluation findings. And I'll pass it back to Dr. Lam.
Thank you so much. If we can advance to the final slide, please. So I'd like to conclude that the vaccine engagement teams are currently funded to operate until July 1st, 2022, and we know that there's an ongoing need for equity-focused outreach and the work of the vaccine engagement teams, as both recovery and the public health situation has to be adaptable to changes such as any potential future variants, changes in the severity of the pandemic, or even just policy response changes, such as the additional vaccine doses we saw announced last week with fourth doses. The evaluation that Ms. Akande mentioned on the vaccine engagement teams will inform our proposals for how vaccine engagement teams can continue to support a more equitable pandemic recovery in the next and coming months. And that information from the evaluation will help us propose the continuing equity-focused responsive model that can attend to the public health and other service, including social service needs, potentially, of the population. So we aim to come forward with recommendations that would build on the successes and the learnings from the TO supports and vaccine engagement teams model. And those recommendations with some details will be shared by both Toronto Public Health and Social Development, Finance and Administration in the forthcoming report to the May 16th, 2022 meeting of the Board of Health. Thank you very much.
Thank you, Adirondack and Dr. Lamptey. Colleagues, those are the two presentations on these two items. We're now going to move. We have 3 registered public speakers who we'll hear from, after which we'll move it into committee for questions. So I'll ask clerks for their help here to connect our first speaker, Samuel Kaufman. If Samuel is on the line and can be unmuted, please.
Hello, Board. Hello, Chair.
Good morning, Samuel. We can hear you. Thank you for joining us. You'll have 5 minutes. I'll give you sort of a heads up at the 30 seconds left mark, but you can begin when you're ready, and thank you for joining us, Sam.
Thanks. I'm here to speak about COVID in Toronto schools. Let me begin first by providing a brief overview of the situation at my kids' school, Earl Beatty, at BDSB Elementary School with about 450 kids in East Toronto. For context, before Omicron hit, we had 4 cases announced at our school for the entirety of last fall. But Omicron is a whole new world. Since January 25th, we've had 60 confirmed cases reported to the school. 33 of those have come in the last 3 weeks since March break. 19 of them have come in the last week alone. That's about 5% of the student population being infected in 1 week. The trend is accelerating dramatically. I will also add that we are seeing likely in-school transmissions because we're seeing cases being reported in the same classes a few days apart. Now, this is happening at every school across the city. The Toronto Catholic School Board reporting is particularly informative, and there are some shocking examples of schools reporting dozens of cases a day. You can also look at TDSB absentee reporting, which is public. Total student absentee rates have moved from about 8.5% in early February to about 12% now. So, for example, at my school, we're getting about 0.5%, 2 to 3 kids sick every day, and they stay out for about 6 days, and that works out to about a 3% absentee rate. So the numbers check out either way you look at it. Now, any way you look at it, a 3% prevalence on any given day, or a 0.5% to a 1% daily incidence, is a lot of kids. The TDSB has about 250,000 kids. So that's about 1 to 2,000 TDSB kids being infected with COVID-19 every single day. Remember, the official case count is not a complete number. It's PCR-confirmed cases only, and access to PCR is much lower than in previous waves. Now, it's not just kids that are the issue. Education workers, like all workers, deserve safe workplaces. And with these prevalence rates, it's very hard to believe they have them. And workers in all sectors are being similarly exposed. Now, if I can figure this out from crowdsourced and open reporting, I assume the Toronto Public Health, with its professional staff and institutional relationships with school boards, can do just as well. This was all very predictable. Once masking requirements and other protections were dropped, the surge was inevitable. It makes it all the more confusing that many members of the board, and in fact all the city councillors, with the notable exception of Councillor Fillion, voted to remove the city's masking bylaw a few weeks ago on the medical officers of health recommendation. Now, for the record, I have a number of questions for the board that I think many other members of the public have as well. Frankly, it looks as if TPH has given up doing anything to control a pandemic. And by doing, I don't mean pleading with the public. I mean actually doing things like creating rules and setting clear expectations. I know that deputations don't generally receive an answer from the board, and I haven't received satisfactory answers to these questions in private correspondence. So I and many others would appreciate public messaging answering the following questions. The first question is regarding data. Is Toronto Public Health aware of or tracking these confirmed cases in Toronto schools? If not, why not? Despite these absences being well below the 30% absence threshold that triggers reporting, is this a concerning pattern meriting public health measures? Does the TPH plan to assess the amount of COVID-19 transmission in schools going forward, and how? What information are schools providing to TPH, and is that information adequate? If you plan on measuring only absentee rates, what justification is there that this is a precise enough measure? Does Toronto Public Health currently have an estimate of the number of new in-school COVID-19 cases a day, like the ones I just provided to you? Second, regarding goals and targets. How much COVID-19 transmission in schools is expected now given current community prevalence? How much is considered acceptable and why? What measures may be taken if transmission exceeds these levels? Number 3, regarding protective measures. Does the TPH still recommend, despite not requiring, masking, distancing, and toileting? Why or why not? If there's a recommendation, why not make it a requirement? Why does Dr. Davila not use her Section 22 powers? Number 4, regarding communications. Now, I heard some agenda items on communications, but, judging by behavior, current communications regarding endorsement of masking in schools are woefully inadequate. School boards like the TDSB seem to be afraid to endorse or require masking and other safety measures without public health direction. So can TPH provide clear communication regarding this to help the school boards at least endorse and require, hopefully, masking and other safety measures?
And Sam, just to give you, I don't mean to interrupt, Sam, just to let you know you have about 15 seconds left.
Last question, contact management. Given the relaxation of safety precautions, does the TPH plan to change its advice on case and contact management for exposures to known cases in classroom settings? Is there justification for treating close unmasked contact for several hours each day as less risky than contact in private households? We need clear answers to all of these questions. They're a minimum level of transparency we would expect of a public health body during a crisis. Thank you very much.
Thank you very much, Sam, and thank you for joining us this morning. Let me open it up. Are there questions from the board for Sam? Okay. Seeing none, Sam, thank you very much. We will proceed to our next public speaker, and I'll turn to our team and clerks. Do we have Greg, and I apologize if this is a mispronunciation, Nittle on the line?
Yes, I'm here, Councillor Cressy. Can you hear me?
Greg, we can hear you loud and clear. Thank you for joining us this morning. You'll have 5 minutes, and you can begin when you're ready, and I'll try to give you a heads up when you're at about the 30-second left mark, just so you're aware.
Okay, address these comments particularly to my councillor, Mr. Paul Ainsley. Please see the website f2sg.substack.com for the speech notes and references for this speech. First of all, vaccinating children for COVID-19. Public health authorities in Florida and Sweden no longer recommend vaccinating healthy children for COVID-19. Florida guidance for pediatric COVID-19 dated March 8, 2022, and Sweden, no general vaccination against COVID-19 among children 5 to 11 years in Swedish. Are they spreading misinformation? What evidence is TPH relying on to ask Ontario to mandate COVID-19 vaccinations for school attendance? Second, lack of measurement. TPH lacks a clear definition and clear measurement of overall public health. Your objective ought to be something like maximizing the quantity and quality of life of the citizens of Toronto. You have no analysis of even something as basic as mortality in Toronto. The best I can find for you is the Statistics Canada Provisional Deaths and Excess Mortality in Canada dashboard. This only breaks down to Ontario and is currently at week 42 in October 2021, lagging about 6 months. By eyeball, the weekly deaths for Ontario in 2021 are running at about the same level as 2020, if not higher. If this also holds for Toronto, then it's not clear that TPH's tunnel vision focus on COVID-19 in 2021 improved public health in Toronto at all. With all the academic and medical resources we have in Toronto, we ought to be able to measure better than this. If not, then Toronto is never shy about asking higher levels of government for help. Third, masking. TPH continues to support masking, but without citing any evidence. Vinay Prasad is the author of over 350 academic articles on cancer drugs, health policy, clinical trials, and better decision-making. I'd like to highlight two recent videos from Vinay on YouTube. One, Masking Kids 10 to 11, a new natural experiment from Finland. Did it work? Which refers to a study called Use of Face Masks Did Not Impact COVID-19 Incident Among 10 to 12-year-olds in Finland. And the study authors say, we compared the differences in trends of 14-day incidences of COVID-19 between Helsinki, which used masking, and Turku, which did not mask in schools, among 10 to 12-year-olds, and for comparison also among ages 7 to 9 and 30 to 49 by using join point regression. According to our analysis, no additional effects seem to be gained from this based on comparisons between the studies and age groups of the unvaccinated children 10 to 12 years versus 7 to 9 years. And second, are there any good studies of masking school-aged children, question mark? Recent results from Spain, which refers to unraveling the role of mandatory use of face-covering masks for the control of SARS-CoV-2 in schools. Quasi-experimental study nested in a population-based cohort in Catalonia, Spain. Spain required masking children in schools starting at age 6. Researchers in Barcelona performed a retrospective population-based study among almost 600,000 children aged 3 to 11 years attending preschool, 3 to 5 years without face-covering mask mandate, and primary education, 6 to 11 years with face-covering mask mandate. There was a steady increase in SARS-CoV-2 transmission with age without any gap between 5 to 6 years. They concluded face-covering mask mandates in schools were not associated with lower SARS-CoV-2 incidence or transmission, suggesting that this intervention was not effective. Instead, age dependency was the most important factor in explaining the transmission risk for children attending school. And finally, vitamin D. The English Office for Health Improvement and Disparities, Department of Health and Social Care has issued an open consultation vitamin D call for evidence. This is backed up by data showing that 13 to 16% of all adults have low vitamin D status, and mean vitamin D status is higher in white adults compared with people from Black, African, Black Caribbean, Black ethnic groups, or South Asian adults.
Greg, you're just coming up at 5 minutes. If you wouldn't mind wrapping up in a sentence, please.
Okay, so you are not a serious public health agency if you don't understand and publicize the critical role of vitamin D in overall health, including viral infections. Thank you.
Thank you very much, Greg. I'll now seek to open it up to see if there are any members of the board with questions for you. Okay, seeing none. Greg, thank you very much for joining us in your deputation. Our final speaker on this item is Derek Moran. Do we have Derek connected on the line?
To the chair, that speaker is not connected.
All right. I will check again. Nahom, if you wouldn't mind, I'll just check because he is registered to see if he is on the line. If you wouldn't mind checking once more. Still not connected, Nahom?
To the chair, we've checked again, and they're still not connected.
Okay. Those are our speakers on this item. Then we're going to move this into committee for questions. And again, we do have two members of the board. We do have two items we've pulled together here. So certainly there's no expectation that people need to get all their questions in 5 minutes. We will do another round. Of course, it's necessary. So let me open it up. See Councillor Layton. Councillor Layton, followed by Councillor Fillion. And Councillor Mulligan and Trustee Donaldson. And so we'll start with the four of you, and we'll then go back to others. Councillor Layton, when you're ready, over to you.
Yes, thank you very much. This is to Dr. Davila. It is around schools and your advice to schools. So I'm one of those parents with two kids in elementary school. One is before the age that they can receive the vaccine. Late last night, got an email from the principal to all school members. We had, I think the number was 15 new confirmed cases, mostly between grades 1 and 3. I don't think I'm alone. I in fact know I'm not alone, because there are other folks speaking on the call. There's other parents with young kids in childcare on the call. I'd like to get a better idea of what your advice is around schools and staff and students, and then what authorities we have. Is it your position, is it your advice that masks be worn by staff and students in schools?
So through the chair, Councillor Layton, thank you. I will try to make my answer as precise and as brief as I can be. So first and foremost, one, when it comes to policies within the schools and what the appropriate measures are there, I will say this: the province has been quite clear, and it is around the fact that they have purview there over and above that which we can do within the context of local public health. So it is an area where the province, if you will, reigns supreme. I think the other point that's worth noting for the benefit of the board is just looking at the most recent report on children and youth, COVID-19 in children and youth. These are internal data that we use at Toronto Public Health to help inform us. Looking at case rates of COVID-19 per 100,000 population, and looking in particular at those who are school aged, the rates were, roughly 3 to 5 times higher in early January compared to where they are right now. So yes, we are seeing an increase in the last couple of weeks for sure, but just looking roughly at the data here that I have in front of me, definitely higher in early January. Overall though, my advice to the public, and yes, this applies to school, is that we are in a period of increased COVID-19 activity, and therefore we need to use all the tools available to us that we have acquired over the last couple of years. This includes wearing our masks, especially when you're in indoor environments. And school, just given the weather right now, is still largely indoors. So yes, schools, I recommend that people, staff, and students should be wearing their masks. I, of course, would be remiss if I didn't speak to my recommendation around getting all the vaccine doses for which you are eligible at this point in time. That's students and staff in the entire school community. Stay home, please, if you are sick. Monitor your symptoms. Do use rapid tests as they are available to you. And for those who are eligible to receive treatment, I would encourage, get in touch with telehealth, our provincial counterparts. Find out whether you're eligible for treatment, and please, for those who are eligible, take advantage of the treatment. It is the combination of using all the tools that we have available to us that actually will help us get through these periods of time where there will be increased COVID-19 activity in our community. We're in one now, and I don't think it's going to be the last that we will see of its kind in this community. So I would just remind people to keep using the tools and knowledge we have, and we will encourage and continue to really promote the use of all these tools, including the use of masks.
So I'd like to just go a little deeper in, as I think is going to be my final question, as to why TPH does not have the authority to impose mask mandates in schools.
So, Councillor Layton, very briefly, I will say this: the province has made clear that when it comes to policy within schools, they are the lead. We do have some latitude where we have very specific knowledge of conditions within a school where we may be able to use our existing powers, myself or my AMOH colleagues, but it is meant to be used on a case-by-case basis, specific to unique circumstances where there is a communicable disease. and very concrete information that we have that there is an action that can be taken to reduce a specific risk within a school. This is a little bit of a legal thing, and one that takes a lot of conversation and a lot of explanation. But overall, the major and overriding theme here is that policy within schools, at this point in the pandemic, we have been advised very clearly that this is something that the province wishes to exercise purview over, and it is actually their area of responsibility.
Okay, thank you.
Councillor Phil.
Thanks. I may come back to schools if there's time, but just first of all, I wanted to ask about fourth doses, both our capacity and demand so far at the city clinics.
So thank you, Councillor Fillion. Through the chair, we actually have quite a bit of capacity. The last I have is an update from this morning. We are actually less than 20% booked at this point in time in our clinics, so we have plenty of capacity. But of course, vaccine is available in many, many channels, or through many channels in the community, including our pharmacy partners as well, just to name one. Primary care partners, other clinics that are out there, but certainly we have lots of capacity to accept those who are eligible and interested in receiving fourth doses of vaccine in our clinics.
So far, the uptake, the level of interest is less than when third doses became available, when certainly age groups were kind of clamoring to get in. I think we were pretty full at the time and trying to get the third doses to everybody. So it's quite a noticeable lack of people running in to get another dose.
So through the chair, Councillor, I'm not sure that I would say that quite that way. Certainly, third doses weren't as hotly pursued as perhaps the second doses were, but I have noted, just looking very quickly at numbers this morning, certainly seen an improvement since the announcement of the fourth doses, more uptake, more interest, more activity at our clinics over the last few days. Again, relatively new announcement, and we don't have a huge proportion of our population at this point in time that is 5 months post-dose 3.
Right,
so
right.
The greater proportion of our population officially becomes eligible as per the recommendation of the province in a few weeks' time yet.
Right, thank you. I wanted to ask about Paxlovid, and it seems to be kind of a big mystery how one would access it, and I know you're trying to do something about that, but I was, for example, talking to a friend on the weekend who's 69, has fairly severe asthma to the point where she's been hospitalized a number of times with asthma, doesn't have COVID, but I would think logically if she was to get any symptoms at all, should rush to get a test and probably rush to get the medication if that's what a doctor would recommend. But, had no idea how to do any of that. And that would seem to be pretty common. I wouldn't know how to do it if I thought I was in that situation.
So through the chair, Councillor Fillion, I should hope that you might see fit to reach out to us and at Toronto Public Health, and we could help you. Certainly, we have tried to advise our public that when it comes to getting information around treatments and COVID-19 treatments and eligibility, it is part and parcel of the provincial healthcare system. So we've provided people with contact information into the provincial system, including telehealth. You're quite right that the recommendation I've put in front of the board is aimed towards ensuring that our provincial counterparts provide more information to healthcare providers and to the public, and we're certainly happy to help in that regard. to make sure that people have the information and know how to take advantage of these new treatments that are available. Big tool in our toolkit. And then finally, I would just say this, it's my understanding, just keeping an eye on the multiple channels we've got going here, that there is, we believe, a provincial announcement of some kind coming out, possibly as early as this afternoon, in respect of COVID treatments. So hopefully we will see a significant change in terms of the uptake and the knowledge of the public and healthcare providers around these treatments.
Okay, well, that would be helpful. My questions may be irrelevant till we see what that announcement is. But even if you go to I went to a hospital site and they said, if you have symptoms, come right on in and get tested if you qualify to be tested. And it's hard to figure out if you do that. And then when you looked at who qualified for Paxlovid, it was like, people who qualify for Paxlovid are people who qualify for Paxlovid, But thank you. I may have some other questions, Mr. Chair, if no one else asks them, but thank you.
So through the chair, Councillor, the substance of the recommendation that I've put in front of the board is, yes, around ensuring better knowledge of treatment, but as well, just general better support to the public as we navigate this next stage of the pandemic. We do have tools available, more broadly available to the entire public. And I am keen, as is the rest of Toronto Public Health, to make sure that people are aware of what the options are so that we can help people navigate this rather complex environment more successfully.
Thank you.
Thank you.
Thank you. Director Mulligan.
Thank you, Chair Cressy. Dr. DeVille, I have two kind of sets of questions, one about the public health protections and the other about the data and the new data that you're hoping to collect or planning to collect. First, about the protections and masking in particular. Public Health Ontario came out with some updated evidence review and guidance on Friday of last week and suggested that re-implementing universal mask mandates was advisable at this time. And I know you've answered about what there are the limits to TPH's capacity to act in schools, but what about more generally? I think many of us are struggling with what can TPH do and not do when it comes to mask mandates.
So through the chair, very briefly, as challenging as it is for us in schools, it's even more challenging when it comes to mandates per se, when you're talking about the broad community. Hence, you've seen us, and we've used this to good effect in the past, make recommendations around now is a good time to use masks. We have increased activity in our community, hence now is a good time to use masks. I would just remind the Board of Health, cast your mind back to early 2020. Much of what we did was premised on recommendations and advice. And I think that we recognize that as we move forward in time, there will be periods of time where there is more COVID-19 activity in the community. And hence, we will offer advice on what appropriate courses of action will be. There may be times where it is, you have less activity and perhaps one can be a little less vigilant around mask use or a little more free, if you will, around social interactions. But right now, given the activity in the community, we would recommend adding layers of protection at this point in time, recognizing that there may be other times in the future where perhaps less layers of protection are needed by most members of the public. There will be some who, because of immune compromise, will need more. I think the other point I would say is that I did read the Public Health Ontario statement and evidence brief with great interest. And just looking overall, when we look at all the data that are out there, I think we know that there are tools that make a difference, masks being one of them. But I think that when we look back over the course of that which we've already been through in this pandemic, I think we have to recognize and approach it with a certain degree of humility that we don't really understand absolutely everything about COVID-19, particularly new variants and new subvariants as they emerge. We've seen jurisdictions all over the world, many of whom have very similar circumstances as we do, and jurisdictions throughout Europe, all with more or less somewhat similar protections and measures in place, but with some jurisdictions with increasing COVID-19 activity, some flattening and some decreasing. And while we can look to the measures as part of it, it's not entirely clear to me that we know exactly why one area is going up, one is holding, and another is decreasing. But we do know that we have tools. They make a difference, as imperfect as they may be, and that we should use them at this time.
Okay, so just to go back to the original question, what can Toronto Public Health do right now? What is within Toronto Public Health's capacity? Is it just health promotion campaign and messaging for individuals, or is there something else that is within TPH's power right now? Just so that we're clear as a board as to kind of what options are available.
You know, through the chair, Director Mulligan, I note the term just. I wouldn't use just with health promotion campaigns. I think we can be quite effective in the use of health promotion and communication to support better use of the layers of protection. I do think that that's very important at this point in time and has always existed. We have the power to exercise within the Health Protection and Promotion Act in very specific circumstances. It's hard to delineate all of those. I know that our public health legal counsel is here, but generally the way in which the powers under the existing legislation are meant to be applied when it comes to the control of communicable diseases is in very specific circumstances where there clearly is the presence of a communicable disease and a very specific action that needs to be taken in order to reduce risk or mitigate a health hazard within that particular setting. So that at a high level is the power that's available to us. But to my mind, and we're constantly exploring this as a team and with our partners, we do believe that there is an opportunity to really promote optimal use of the layers of protection given where we are at this point in the pandemic.
Thank you. If there's time, Mr. Chair, I'd love to have another round of questions.
Yeah, no, we will come back for all who want another round, of course. I have Trustee Donaldson followed by Councillor Wong-Tam, and then we'll see other members with the first round, and we'll come back for a second. Trustee Donaldson.
Thanks, Chair. So I just wanted to pick up a little bit on what Councillor Layton was asking about with respect to schools. So the Toronto District School Board, before the mask mandate was lifted, asked the province to extend for a period of time in our schools. And one of the things that we also asked was particular advice on settings, our congregate settings, where we have medically fragile students. And we didn't really receive a response on this. So I guess my question is to you, Dr. Davila. I'm struggling to understand how a setting is classified as high risk and therefore requiring further requirements, i.e. masking requirements for staff in particular. So what would you say to the TDSB about how we can better protect our vulnerable students, our medically fragile students in these settings? And further to that, if we believe that we are going to be struggling with this pandemic for the foreseeable future, do we really at this point have the local powers that we need in order to intervene in these specific settings? Thanks.
So through the chair, a couple of things. With respect to that which is defined as high-risk settings, I'm afraid that that is really something under the provincial purview. They've made that determination. Happy to follow up with them around what characterizes high risk to their minds and in their decision making. So I'm taking that as we will follow up as per your request and as per the board's request. What can be done now? It is worth repeating. We have tools and knowledge available to us. right? And I think that the more we are able to, in concert, collectively and at the individual level, use these tools and knowledge to good effect, the better off we will all be. I would just remind the Board of Health that throughout the course of the pandemic, right, what has always been fundamental and important, regardless of whether mandates were in place, was the cooperation of people and Torontonians actually taking on the actions that are needed to protect themselves and others. Enforcement is actually a little bit of a sidebar, if you will, because in fact, actually enforcing across a city of this size is, and with the number of people that we're talking about here, would be a virtual impossibility. So at the end of the day, what we have always required is the goodwill and the good practice of people of Toronto. And we have actually, I think, been quite blessed to see that that cooperation has been in place. So Trustee Donaldson, we're talking about vaccine uptake. And certainly we're doing everything that we can at Toronto Public Health in terms of what we can do. Wearing masks, staying home when sick, pursuing treatment where that's an option. Really screening within the context of schools, actually really doing that screening before showing up at school and making sure that you're mindful of symptoms. And then practicing what we know are just good infection prevention and control behaviors. And certainly, I won't get into the details here, but the entire school health team is certainly available to support our TDSB partners and schools, and the Toronto Catholic District School Board, of course, and all other schools within the city. It is the combination of using the layers of protection that we're aware of at this point in time that will get us through this particular period of increased COVID-19 activity, and will also be fundamental for us to mitigate the negative impacts of the future waves of activity that we can anticipate we will see in the future.
Thanks, Dr. Davila, and thank you in advance for following up with the province on the high-risk setting question. Really appreciate that. That's it for me, Chair.
Thank you. I had next on my list Councillor Wong-Tam.
Thank you, Chair, and through you to Dr. Davila, I want to ask a question that is related again to the masking requirement. At our city council meeting, and of course only the councillors are probably there, there were comments that should the trends change, or should the situation change, that yourself and other officials would revisit the question about masking. So I'm just curious, because I've gotten a number of inquiries from constituents, and also as the chair of the Disability Advisory Committee, we've had lots of conversations about whether or not the trends have changed. And so I'm just, if you can just confirm for us that we have not reached a state where the increasing trends will bring back even a temporary reinstallation of masking.
So through the chair, Councillor, we had anticipated, right, as the province proceeded to loosen public health measures, that there would be increased activity. And when you look overall, actually, and look in particular at the most recent reports, including the one that we've just referenced, I think it was Director Mulligan who had spoken to the Public Health Ontario recent report. It shows that we actually have seen over time, in concert with the loosening of restrictions, a general tendency and trend towards increase of COVID-19 activity. So not entirely unanticipated. This is, what we had expected we would see, more COVID-19 activity. The notion here, of course, is that this then requires us as a local public health unit, one, to communicate that, and two, to offer advice on how best to actually manage that which is being seen. And at this point in time, we are providing advice to the public, as I just mentioned to Trustee Donaldson, that the use of more layers of protection right now is what's warranted at this point in time, and may further be warranted at other points in the future when we expect that there may be, or when we can anticipate that there will be more COVID activity in our community. So we are continuing to observe, and of course we're speaking with our provincial partners. I would suggest to you, just for the board to know, that when you are dealing with a highly transmissible variant or subvariant like Omicron, whether it's BA1 or BA2, which is a sublineage, which is even more transmissible than the original version of Omicron we encountered earlier this winter. Having something followed, especially when we talk about the GTHA, where we have so much movement, having measures that are put on a provincial basis actually makes far more sense. But that being said, what we are able to do at this point in time is to ensure that, one, we're monitoring the trends, and two, informing members of the public around how best to use the knowledge and tools that we have in front of us to address the current circumstances so that they can protect themselves and those around them.
Thank you, Doctor. And so if the province continues to stay course, perhaps does not reintroduce any of the masking requirements or mandates, are you suggesting that, Toronto, if you have the same opinion, obviously we follow it, but if you have a contrary opinion, will you be able to voice that and share that with the board?
So through the chair, I'd like to think that the board would agree with me when I say that I've always been upfront with you around what I have felt and what the team here at Toronto Public Health has felt is necessary in order to best protect the health of the residents of Toronto. We've always done that. And we will continue to do that, regardless of what our colleagues at other levels of government choose to do within their mandates.
Thank you, Doctor. And when we meet with the members of the disability community this Thursday, we've got a special consultation with them to speak about the masking requirements. I believe that they'll need to hear that same message from you in those conversations as well. So I'll look forward to that discussion. Thank you.
Thank you, Councillor.
Thank you, Councillor. Let me see, to members of the board who haven't yet asked questions in this first round. I have Director Sue Wong. Are there other members of the board who have questions? And I'll go back for a second round. Just looking through. Director Sue Wong.
Thank you very much, Mr. Chair. Through you to the Dr. Davila. I have three questions. Let me put the questions out to Dr. Davila. First, I noticed that the data that you presented this morning, Dr. Davila, the data dealing with the children and youth vaccination went up slightly, but not over 60 or even 80% like the general population. What can we do more compared to other city or municipality that are better rates than us? Okay, because I'm concerned, given what we just heard this morning, and the data with the young people are not responding similar to the general population. Second, we just received notice today that the screening kits have gone to the private school. What can we do more to ensure, the screening kit that's being reported today, to ensure the 4 largest school boards in the city have access to these screening kits? Because this is supposed to ensure our school community is safe. It's not exclusively for the private school. What can we do more to advocate to the province to ensure our school community have access to these kits? Because I heard concerns out there. Parents aren't getting them. Teachers and educators and staff of the schools are not getting them, yet the private schools are getting them. Well, that's not equitable. My last question to you, through you to the chair, is that I read this, one of the presentation slide this morning. The engagement teams indicated that dealing with the equity funding ends on July the 1st this year. I'm concerned as a board member that after July the 1st, I'm not convinced this COVID-19 is over, will staff be coming back with a report before July the 1st to ensure this funding, if required, to advocate continued funding? Because July the 1st is around the corner. It's beginning of the summer. And I want to make sure that staff is coming back to let us know, and we need to do whatever it takes to get the funding to protect the community. So those are my questions, Mr. Chair. Thank you.
Okay, so through the chair, thank you for the questions, Director Wong. So why don't I might take them in a slightly jumbled up order, if you don't mind. Let's start off with the engagement teams. As you heard from my colleagues, both at Toronto Public Health and from the Social Development, Finance and Administration Division, we have another report coming to the board next month in respect of the fulsome evaluation on the vaccine engagement teams. I think that is perhaps the more appropriate place, if you'll allow me to come forward with a recommendation to the board on what the next steps for these vaccine engagement teams look like. You I would imagine, want to have the evaluation results in front of you so that the decision can be made in the most informed fashion. So that is, stay tuned, I think is what I'll say, until next month's meeting, and perhaps we can have a more fulsome discussion at that point in time. With respect to vaccination of children and youth, what has been seen in other jurisdictions is, and what we have seen ourselves when it comes to vaccine uptake, is making vaccine as available as possible, as accessible as possible, is part and parcel of lifting up vaccine uptake. This is no different for children and youth. So we are certainly continuing on with school-based clinics to help make it as easy as possible. The jurisdictions throughout Canada that have had the greatest success have certainly used this to good effect, and we are taking a page from them. We would also say, however, that when it comes to new vaccines for children, and I would, advise, I'm sure Dr. Wong and Dr. Bowery would have some experience in this regard. Any vaccine for children that is relatively new and introduced does generally take time before people take it on. Parents, understandably, are often quite concerned about new vaccines, even when they have been studied for many years and gone through what we would say a more standard route to market relative to the COVID-19 vaccines. So I think the concerns are perhaps even greater in the context of this particular vaccine. That being said, as more and more primary care providers, community-based providers get engaged in the vaccination efforts, there is an opportunity to have a discussion around the vaccine in the context of a trusted relationship. Somebody who knows you, who knows your family, and can actually have that one-on-one conversation and really get to the heart of the concerns that might be there, and to address them. This is a safe and effective vaccine. My recommendation, I'd like to think, has moved some people, but I recognize that there are going to be others who perhaps need a more one-on-one conversation, and I would encourage people to seek out that advice from a trusted healthcare professional. So that, I think, in concert with the efforts that we're putting forward to facilitate access, I'm hoping will over time get us there to a higher uptake of that vaccine. With respect to the kids, what you advised me in respect of the private schools, I'm sorry, is the first I've heard of that. It sounds like it's something new. I'm happy to take that offline with our staff and want to ensure that people who have access to the tools and the knowledge, as we've just been discussing at great length here this morning, to help us navigate appropriately through this very challenging time of the pandemic. And again, I would emphasize that the more that we can do things like screening over and above using rapid antigen testing, screening, mask use, staying home when sick, following the advice in respect of limiting interactions and isolating appropriately when you've got symptoms, even if you're not, 100% sure what it is. The more we are able to limit the likelihood of transmission, the better off I think we will all be.
Thank you, Director Wong. Before we go to a second round, let me just see, in the first round, any members of the board with questions. I'm going to put my name on the list. All right. Doctor, a couple from me. In this sixth wave that we're in at the moment, do we have a sense from modeling that has been done, that you've seen, and looking to other jurisdictions, where we are in a sixth wave, at which point we expect this wave to peak, for example?
So through you, Mr. Chair, as you know, I'm not a modeling expert, and I try not to venture too far into those areas where I am not expert. I will advise the board, though, that based on some of the preliminary information that I've been privy to, and based on what I can see from other jurisdictions and their experiences, my understanding is that it's on the order of a couple of weeks that we may anticipate hitting a peak here, and then seeing our decline in respect of COVID-19 activity. Lots of caveats around that. As I've mentioned earlier, it's interesting to see we don't fully understand. We know some factors and tools and knowledge that we can use to good effect, but we don't have a complete understanding of why rates go up, down, or hold still in different jurisdictions, oftentimes until after the wave has passed, when we can actually look at it in the rearview mirror.
And Doctor, given the transmissibility of the current variant we're dealing with, and other sublineages of the variant we're seeing, and other variants that may yet come, for this board and the public, should we expect more waves in the future?
So briefly, through you, Mr. Chair, I've now mentioned on a number of occasions this morning that yes, we're in the middle of a COVID wave right now, and we should anticipate other waves where we will expect, or we can expect, increased COVID-19 activity. And those will be times at which we must add on layers of protection and really use the full body of knowledge and tools that we've acquired to control COVID-19 as much as we can.
Well, so let me, just on that, given the transmissibility and our expectation of whether it's new variants or sublineages that we will see more waves in the future, there's a lot of discourse about, the line is often used, living with COVID. Now, in the world of public health, we never simply accept living with an infectious disease. In fact, we fight them every single day. So I guess what I'd like to understand in the midst of this current wave, but as we anticipate future waves, some of the immediate actions to reduce risk rather than simply live with. What you think needs to be improved. Your recommendation spoke to accessible treatments. Certainly we're bringing, as you know, motions bringing forward around integrating delivery of services, whether it's treatment and vaccinations and testing on site. What are some of the immediate measures to mitigate risk rather than simply live with?
So through you, Mr. Chair, I've certainly mentioned a number of them now. You're quite right, improving access to treatment, using the existing infrastructure we've established for vaccine to help support better uptake of treatment is going to be part and parcel of that. But the board will not be surprised to hear that the kinds of things we need to continue to do now to protect our community as best as possible will include things like continuing to drive uptake of vaccine and to ensure that people are taking advantage of all the doses for which they are available. Continuing to promote the use of masks, especially now, while we are in a period of increased activity. This is especially important for people who are at higher risk of serious outcomes, and is especially important when we're talking about finding ourselves in indoor environments where transmission risk is higher. Staying home when sick, making sure that we're adjusting our behaviors a little bit as the weather gets better, focusing our interaction with others in outdoor settings by definition reduces the risk of transmission. It's the combination of the use of the knowledge and tools that we've acquired over the past couple of years that really will see us through the challenging periods that, one, we're going through right now, and the challenging periods that we have in front of us as time goes on.
And just a final question for this round for me. So in previous waves of this pandemic, when we saw spikes and we needed to adjust behavior, you issued letters of instruction in areas that are outside of our purview, such as schools. You issued letters of instruction throughout the course of this pandemic to schools to change policies. I guess, given your advice to wear masks in schools right now, why not simply issue a letter of instruction requiring it?
Well, so through you, Mr. Chair, you're quite right. I and others in local public health units around the province have previously issued letters of instruction in the past, but that rested on our ability to do so as delineated under the Reopening Ontario Act. That ability has since lapsed as part of the changes within the Reopening Ontario Act, which is provincial legislation. So it's not an option that is currently available to us in local public health at this point.
So the province revoked your ability to set policy in schools, and now you can only issue guidance. Do I understand that correct?
Through you, Mr. Chair, yes.
We'll open it up. I know there's a request for a second round. I have Trustee Donaldson. I know I have Director Mulligan, Councillor Fillion. Let's start with that and we'll come back. Trustee Donaldson.
Thanks, through the chair. Dr. Davila, for those who are at higher risk of serious outcomes, has the profile of those people changed over the course of pandemic with the different variants, or has it remained roughly the same?
So through the chair, Trustee Donaldson, when we talk about those who are at greatest risk of serious outcomes, we are talking about those who are on the older end of the age spectrum, particularly those who are, again, the older you are, the more at risk. We've seen hospitalizations, ICU admissions, and deaths, unfortunately, impact those who are definitely 80 plus. And again, the older you are, the more risk you see. And as well, those who have pre-existing significant medical conditions, immune compromise, or other chronic conditions have also, people with chronic medical conditions have had more challenges in respect of negative outcomes, serious negative outcomes associated with COVID-19 infection. That has remained fairly consistent throughout the pandemic, and hence the underpinning behind why you're seeing third doses and now fourth doses provided to these populations first. Vaccine, I should say, to be clear.
Thanks. And just an observation, I think that the messaging and what we were all talking about at the very beginning of the pandemic about those who were most vulnerable and at higher risk of serious outcomes was very prevalent. And I feel like we've lost a little bit of that conversation as we've gone on. So I think it would be good to hear a little more of that going forward. Thank you.
Through the chair, Trustee Donaldson, if I could just add a little bit, I think that it is important to note, though, while we see that those who are older and those who have immune compromise, for example, continue to be at higher risk for severe outcomes, as I hope I've demonstrated through some of the slides in the presentation, vaccine has made a substantial difference. We see a huge difference when people are actually taking up the vaccine for which they're eligible. We are seeing less by way of those serious outcomes, hospitalizations, ICU admissions, and deaths, even amongst those who are older and immune compromised. There is, again, a very good tool at our fingertips that's available to us. Add to that treatment, and hopefully as that gets taken up more, we'll see even more of an impact in respect of changing the outcomes and protecting the health of members of our community, especially those who are older and immune compromised.
Thank you.
Thank you, Trustee. Director Mulligan.
Thank you, Mr. Chair. Dr. Davila, I just wanted to return to my questions and focus on the data. So there are a couple of indicators that I think would be really helpful to our decision making at this stage of the pandemic. And I wanted to ask whether these data are accessible to you, whether it would be reasonable to consider using them in a dashboard or in other reporting. And they would be on child hospitalization, COVID rates or outbreaks in schools, and data we have about the hospital workforce. As we know, that's an important indicator of the hospital and health system capacity. Are those data that TPH would have access to?
So briefly through the chair, I would say generally yes. The question is, what is the value with respect to dashboards? Which parts do we use to inform our practice and to inform, updates to the public in general around what are the appropriate behaviors, and which things actually go out for regular reporting. To my mind, there is so much information that's already being circulated out there. And for those of you who are active users of social media channels, there is a lot of, just a lot of data sources out there. So from our perspective as Toronto Public Health, I think, it's beholden on us to make sure that we're putting things up on the dashboard that people can actually put to good use within their daily lives. So please note that there is that which we share with the public to help inform their own actions, in their daily lives. And there's that we use by way of data to help inform our policies, our actions, so that we can do what we can, and we can share with our partners to adjust in accordance with the epidemiology as we see it on the ground. So that's an active part of our conversation as we think about updating the dashboard. What makes the most sense for the public versus that which we need to act upon as the local public health department, and that which we need to share with other partners and stakeholders, given what they are able to do and what actions they have within their mandate and purview.
Thank you, Dr. Davila. I think what you're hearing is that we really value your voice and your expertise, and so the data that you're choosing, I think, also conveys kind of to us as the board and as a public what's important and what matters right now. And it's the same with advice going out in health promotion campaigns that we want to see what's important to you. That'll help us make decisions about what we need to be considering is important to us. I have one more question about the data. And I wanted to know how is TPH or the city or both working with communities facing health inequities in governing and making decisions around the use of their own data? So you have recommendations at the moment about expanding and continuing the use and collection and use of sociodemographic data, including race-based data. So can you tell us a bit about how communities are involved in that work and how we've built or what we need to do to build accountability and responsibility to those communities?
So through the chair, perhaps I can touch on it. I don't know that I can do it justice in this forum, but I suppose the 30-second to 1-minute version is that where we have been working around ensuring that data are available and used appropriately, the general principle that we have tried to deploy as much as possible is working with the communities themselves in what I would describe as the spirit of collaboration and co-creation. Data about specific communities should be used and understood to advance our public health objectives, including reducing health inequities, absolutely. But it should be done in a fashion that actually engages and actively involves the people about whom the data are, right? It's sort of the nothing about us without us, if I can use that phrase. So that's certainly how I see that work moving forward at a high level. I don't know that we can get into a very long discussion here, but and I would like to think that that's how we have tried to conduct ourselves in the past. There's always opportunities for improvement, but at a high level, it is around collaboration, co-creation with the active engagement of the communities that the data are relevant to and about whom the data are.
Thank you.
Councillor Fillion.
Thanks, Dr. DeVille. I'd like to go to one of the charts that was in your presentation that I'm puzzled about. It's the one headed unvaccinated individuals had the highest rates of hospitalization during the Omicron wave, and it shows that in December and January there was this, huge difference between the unvaccinated and the vaccinated, but then in recent weeks it looks like there's very little difference, and again, according to the chart, the vaccinated boosted group actually has a higher rate than the vaccinated not boosted, which doesn't seem to match this chart doesn't seem to match anything else we've heard about vaccination and hospitalization.
So very briefly through the chair, Councillor Fillion, this is a reflection of data still needs to catch up. That's the short version of the story. I don't know that we have a complete picture here. These are the data such as we have them to this point, but there is, as always, a bit of a lag in respect of hospitalizations. So you don't have the full story quite yet. These data, I think, in the long run will be better understood as we look backwards with a more complete set of data. So I wouldn't place too much emphasis on the right-hand side of the graph at this point in time.
But it is rates, right? It's not it's not total numbers.
But we have incomplete data. It's not the complete set of data at this point in time, so I don't know that it's actually giving you a fulsome picture of that which is actually happening.
Yeah, well, I guess I'll just say I'm concerned about it because if it's misleading, maybe we shouldn't use it. It would, it would lead someone who looks at it to think, well, there's no point in getting boosted because it makes no difference.
Well, actually, on the contrary, so with all due respect, Councillor Fillion, I think what we're trying to show here is, in fact, when you look at the Omicron wave, and it's particularly the part that we have more fulsome data on, and where we have a more complete understanding, let's say that unvaccinated individuals were clearly at much higher risk for hospitalizations relative to those who were vaccinated, in particular those who had taken full advantage of the doses that they were eligible for. When it comes to that, which is a little bit more proximal in terms of time, the data are at best incomplete and definitely do not give you a picture of what the real value of vaccination is. Speaking to one of the earlier questions, we talked about those who are at risk for more severe outcomes. No question, older individuals, no question, immune compromised. And we have seen the benefit of vaccination. One only has to look at the experience, for example, within long-term care in 2020 compared to what we saw after the introduction of vaccination. Dramatic drop in terms of deaths and other serious outcomes associated with COVID-19 infection after the use of vaccination. And, this is just another example of the benefit of vaccine.
No, and I'm not doubting that at all. I just think the chart is something wrong with it. Is there anything you can tell us? I know nothing myself about this, but Omicron XE, I saw a CBC report that there was a new, kind of variant of the subvariant that was more transmissible, but haven't seen anything else on it.
So through the chair, Councillor Fillion, not sure that there is much more to share at this point in time in respect of XE. I would say this, when you have a high level of transmission, and it is something we are seeing throughout the world, there are many jurisdictions that are experiencing increased levels of COVID-19 activity. Clearly, the opportunity for new mutations to arise, new sublineages, new variants, etc., exists. So again, that to my mind is yet another call for all of us here in Toronto to continue to deploy the various methods, knowledge, tools that we've acquired over the last couple of years to reduce transmission as much as possible. Councillor, we will keep you informed as we hear more from our provincial counterparts who do the sequencing and have more direct access to those data. But at this point, I don't have very much more to share with you other than the fact that we know that BA2, according to the latest provincial report, is in fact now more than 50% of that which is circulating here in the province of Ontario.
Thanks, Mr. Chair. I had more questions, but I don't want to hog the mic, so I'll pass it back to you.
Not hogging the mic in the slightest. Other members of the board on the second round? Okay, seeing none. Councillor Fillion, you're not hogging the mic. Would you like?
Well, just one more. I'll just pursue
Please.
one more area which I don't think has been talked about here in months, but that is vaccination of students and provincial regulations around that, whether the province should require COVID vaccinations as they do vaccinations for other easily transmissible diseases. And what I'm wondering is what the relative risk of COVID is compared to those health risk, and not only to the students, but to the families that they would then bring the infection home to. And based on that, and this may be an unfair question to spring on you, but how COVID would rank compared to those, and if COVID is equal or more of a threat to the health of the population, shouldn't we be renewing our request of the province to take some action around that?
So through the chair, Councillor, as you know, there has been a motion already moved by this board in respect of include COVID vaccine as part of the regular immunizations covered under the Immunization of School Pupils Act. We have raised this with the province. I will leave this to you and your colleagues to make a determination as to whether that call should be repeated. But I can assure you that we have raised this issue with the province on several occasions and continue to do so. With respect to the relative risk of other diseases that are covered under the ISPA, I don't know that I can provide you a very definitive answer with very specific numbers. I would tell you this, though, that given the COVID response and all that it has taken for us as Toronto Public Health and other partners to respond to, we have not been able to conduct the same kind of assessment on student immunizations as we normally do. So we do have some concerns around whether students are getting the appropriate protection through routine childhood vaccinations. We also know that, in fact, colleagues like Dr. Bowery and perhaps Dr. Wong might be also well positioned to inform you in respect of what's been happening in primary care and in pediatric care over the course of the pandemic. It's been challenging to get the uptake on some of these vaccines. Other routine care has certainly been impacted, including childhood immunizations. And we know that our school immunization program, our routine school immunization program, has also been impacted as a result of the pandemic. We've not been able to provide hepatitis B or HPV vaccine, or meningococcal vaccine as we normally do. So those protections have not been provided to our students in the way they normally would be in non-pandemic times. How much more risk this creates, we know the risk is elevated. How it lines up against COVID, well, clearly there's a lot of COVID in our community, and we know that the risk of exposure to COVID is higher at this point in time, especially now with increased activity in our community. But what we are doing is certainly trying to make COVID vaccine as available as possible to all children and youth over and above the rest of our community. And as well, we are providing opportunities for people to get the vaccines we would normally provide through the school immunization program. Yes, through our school clinics that we're offering right now, and as well through our other vaccination clinics on offer. We have been trying to make sure that we're taking every opportunity to address care that might have been neglected over the course of the pandemic where we can, as much as we can.
Thank you.
Thank you, Councillor.
Let me just see a final, any others, members of the board with questions? Otherwise, we'll move into speakers. All right, we'll move in for speakers. I'm going to put myself on the list. Do you mind if I draw up a speakers list here? Others who wish to speak on this item. Councillor Perks, Director Mulligan. I don't see your hand up, but I know we've been texting, so I see that. All right, we'll begin there. So let me kick it off, and I will begin first by thanking many members of the board for the work in preparation of these motions. I know I moved them on our collective behalf, not my own. So I will place on the floor here the recommendations that the Medical Officer of Health has put in front of us in her presentation this morning. That specifically deals with the need for the province to get treatments out the door to those who need them now, as well as additional recommendations around the need for the continued collection of socio-demographic information in the absence of widespread testing, as well as, so in addition to moving Dr. Davila's recommendations, a number of recommendations from us for Toronto Public Health to continue working with Ontario Health and our community and health system partners to integrate testing, treatment, vaccination, and other on-site health and social services on-site for further integration of the wraparound model of care, to scale up our third and fourth dose outreach, in particular through our VaxTO calling program that goes directly to those eligible for third and now fourth doses, for public health, for Toronto Public Health to launch a promotion campaign to inform the public as clearly as possible of both the risks and tools to mitigate them. And in particular, that highlights right now during this current wave, mask usage indoors in schools, and I'll come back to that. And then for the province to reinstate the capacity for local public health units under the Medical Officer of Health to respond to our local conditions by being able to issue letters of instruction, a tool that we had and which our Medical Officer of Health used to great effect and for great protection throughout the pandemic, including in schools, but which has been revoked to leave us in the position of issuing advice and not instruction. And then I also am moving on item 36.2 as we're dealing with both items here. This is on our equity action plan that at our May meeting, where we will be receiving a report on the work of the vaccine engagement teams and ambassadors to include options and recommendations to extend that work in support of our continued vaccination programs, something I know Director Sue Long spoke to, as well as at the June meeting where TPH is bringing forward a report on health inequities that have been exposed and exacerbated through the pandemic and lessons and programs that have worked to address them, on how the vaccine ambassador program and vaccine engagement teams can be pivoted to address other health inequities. So with those placed in front of us, I'll move those, and thank you once again to all who've worked on those. Let me note a few comments here, and I'll, this is my final time as chair dealing with a COVID item after, as Dr. DeVillo mentioned, 28 months of this board dealing with COVID and 825 days since our first Toronto Public Health alert on what was then a novel coronavirus. And let me begin by expressing a heartfelt thank you to Dr. DeVilla, the Toronto Public Health team, and the board for just relentless work and resolve in the face of an unprecedented 28-month period. I remember back to those early days and the acute fear of the unknown which we were going through, and here we are 2+ years later, dealing with the 6th wave, and it has been a long road. But I will tell you from where I sit that our board, collectively, all of us, we have at all times sought to follow the science, to act quickly. That adage from the WHO right at the very beginning: move fast, have no regrets, and to at all times focus on equity. I harken back to 2 years ago right now when we saw in those shop windows throughout our city the adage, we're all in this together. All in this together, it may be an aspirational statement because we have pre-existing health inequities that have been exposed in this pandemic. To be all in this and together is a commitment to not stop working day in and day out to address health inequity. It is aspirational, but it is also a commitment, and one that never stops, and one that I believe has guided our work every single day. We have not been perfect, but we have at all times sought to not only save lives and protect our population, but to place a clear and overarching frame commitment to addressing inequity at the hallmark of this response. We never lost sight of that core objective. As we go forward, and I hope you'll indulge me in an extra minute here, there will be more turns as we deal with COVID. There will be more waves. There will be challenging times. And as we go forward, I would suggest that it will be the continued role of this board in Toronto Public Health to be guided by 2 principles. The first is that we should never accept simply living with an infectious disease harming our population. Never accept it. Living with COVID does not mean to let it rip and accept the harmful negative consequences. Rather, living with COVID is an endless pursuit to address the harms associated with COVID. The layered tools of protection we talk about, from vaccination to accessible treatments, to adequate surveillance from a health equity focus, to mandatory vaccination in schools, like we do with 9 other infectious diseases. Living with COVID means endlessly and constantly seeking to reduce the impacts of COVID with an equity lens. And the second principle I would suggest is to never lose sight of the need to not only manage an emergency crisis, but to address the inequities that it has exposed with community-based solutions, with better preventative policy. And so I will conclude, having taken more time than I'm deserved here, only to note that to our colleagues in Toronto Public Health, I know after 2+ years that you are tired and worn down and exhausted, but we need you, and we will continue to need you, and our city is indebted to you for this continued, relentless, ongoing work. It never stops, but protecting our population and addressing systemic inequities never does. So we carry on. With that, I thank you, and I turn the floor over to Councillor Parks.
Thank you, Mr. Chair. So this is a lot. We're at a moment right now where so many balls are in the air. It's frankly, it's quite taxing just to keep it all straight. And I want to begin by acknowledging the very important motions you've moved here. Among the simple physical fact of trying to cope with working remotely, wearing masks, getting vaccinated, being uncertain about where you're safe, where you're not safe, trying to figure out what's the right path on schools, all of that weight. We also find ourselves in a circumstance where not only is our knowledge of COVID changing over time, we've been learning lessons, but the characteristics of COVID change over time. We get different variants with different transmissibility, with different risks associated. And on top of that, the jurisdictional issues, which are enormously complex to begin with, they're also changing over time. And, you know, if I'm struggling to keep all of this straight in my head, all of these changing factors, imagine what it's like for the people that we represent here, for Torontonians who are trying to figure out, do I send my kid to school? Do I get my third booster? Is the City of Toronto allocating resources to people who are most vulnerable? Where do I wear my mask? Where do I not wear my mask? I have to tell you, talking to the people I represent, there's a lot of confusion out there right now. And it's not confusion that you lay at any one person's feet. It's the confusion caused by the fact that things actually are changing over time. This isn't a single disease with a single set of rules and a single set of impacts that's been consistent over the last 2 years. Everything about it keeps changing. And I want to draw particular attention to two of the things in your motion that I think will be helpful with that. The first is the call that you are making to reinstate certain authorities to the medical officer of health. I don't think people in the City of Toronto or the province of Ontario understand how devastating the new restrictions brought by the province of Ontario on what medical officers can and cannot do is. And secondly, your call that we refine and reinvigorate our communications to people about what's safe, what's not safe, what's best practice. I know not only does everyone sort of have the fog of 2 years of our lives being upset, but they've got the fog of changing circumstances. And I think we need to really step up as an institution, Toronto Public Health, and say, here's where we are today. Here's our best advice for today. Here's how you can be contributing to minimizing the harms and risks associated with COVID today. So thank you for those. I think you've laid out a good path forward, and I hope we all can step back, take a breath, and dive back into the struggle to protect Torontonians' health and to have clear, coherent communications about this. Thank you.
Thank you, Councillor Perks. I'll now turn it over to Director Mulligan.
Thank you, Chair Cressy. And Councillor Perks, you said a lot of what I was going to say too, that I think it's really important. I think one, local public health matters. Community involvement in local public health matters. And we can't be fully involved unless we're as informed as we can be, recognizing the changes and the complexity of the situation. I think this is one of the reasons why it's so important that we have a recommendation, we have a motion from the board about turning some of the communication into a health promotion campaign in particular. So we're not just hearing these messages about masking at the board, for example, or in press conferences.
Director, I don't mean to interrupt. You have a motion here you just need to formally table.
Okay, and I also further have a motion. My motion is as follows. It's on screen here. It's about including more data, in considering the inclusion of more data on the dashboard, hospitalization for children, transmission of COVID in schools, and absentee data for our health workforce. So now I'm going to speak to this motion, and I'm going to speak to the other motions that we have in front of us. Thank you, Mr. Chair. Being a public member of the board means that I don't follow all the city protocols all the time, and I'm always learning. So so what I want to say is that it is important that we have health communications, that we have a health promotion campaign that includes social media, that includes resources for our community ambassadors, that includes trying to meet people where they're at and reach them, recognizing just how confusing it is right now, and just how important the voice of local public health and the local medical officer of health really is in all this. In this time of change, Toronto Public Health has been an organization that people look to for trusted advice. And we need to make sure that we maintain that role and that we continue to provide trusted advice. And if we are asking individuals to make decisions about their risk and their behaviors, that we give them what they need to know. Recommendations wherever we can about what they should be doing in given contexts, and information on our planning in our dashboards that help us understand things like how much COVID are we seeing in schools? Are kids more being hospitalized more in a given wave than they were before? Is there capacity in the health system beyond the number of beds, but the number of people who work in those beds, who staff those beds? I think this is a really, really important capacity indicator that's been glossed over. That is, it's important for us to know. And I applaud Public Health, Toronto Public Health, for the work that you've done over the last 2 years to be that trusted voice. And I urge you to do the utmost, despite the fatigue, despite the changes in the context, to keep that position, to keep that role of the trusted voice, and to keep the community involved and engaged in governance about our data, in making decisions together, in understanding and following the guidance. We need to be in the know, and we need to be supported in our actions whenever possible. Thanks.
Thank you very much, Director Mulligan. Though for the record, because it's my last meeting, you said you're still learning on this board. We're all learning from you. I've told you this before. Any other members of the board who wish to speak? I see Trustee Donaldson, to be followed by Director Bauer. Trustee Donaldson.
Thanks, Chair. I just have a question on the motion with respect to, I think it was item number 1 that came up on the screen. Is it all hospitalizations or COVID-related hospitalizations?
Sorry, that should be COVID-related hospitalizations, yes. All of these would be COVID-related data.
Great, thank you. That's it.
And to speak, I have next Director Bowery.
I hope my voice is going to hold up. If not, I will text it to you, Chair Cressy. I'm thankful to Dr. Davila for you and your team's continued work, and also the lovely tributes that you presented to our Chair and Vice Chair today. I wanted to speak to some of Director Fillion's concerns regarding COVID vaccine uptake in kids specifically. So as you all know, I've worked in this realm in the community doing outreach as well as in my own clinical setting. And, there's a ton of hesitancy. The vaccine is new, or conflicting data from international sources, as we heard as well today. But also in my world, I hear a lot about communities who are hesitant because they've experienced systemic health institution-related trauma. So these are significant concerns. And I think engaging with primary care absolutely provides these vulnerable populations an environment in which they have existing trusting relationships that can be used and leveraged to try and increase vaccination uptake. And I know we've tried and are continuing to try. However, we've heard a lot about this today. This pandemic has derailed our healthcare system on all levels. On a primary care level, I'll give you a few examples. So screening tests, for example, cancer screening, mammograms, pap tests, colorectal screening has been delayed. Our kids' immunization, so routine immunization vaccines, have been delayed. School vaccinations have been delayed. Kids' developmental assessments, so well baby visits, where usually you get to pick up early signs of autistic spectrum disorder, etc., have been delayed. And supporting our youth, especially at a very vulnerable time from a mental health perspective, has become more challenging because they disappeared. We didn't get to see adolescents as much as we would, and it's challenging to see them anyway. But that's been delayed. So how do we catch up? So we increase our availability. We try and create all these services to try and increase engagement. But I'll give you an example. When 60% of my day in the past 2 weeks has been spent trying to support vulnerable patients who have COVID symptoms and are trying to help them find a test in time for them to access Paxlovid, in the hope that they'll be eligible to get it in the time frame they need to get it when they're living far away from a centralized clinic, when they may have language concerns, they're frail, elderly, unsupported, are working, and it's difficult for them to find childcare or other supports to make this happen. When does the rest of this catch-up work get done? When do we catch up? So it is a big problem, and because of this, I think I definitely support the motions that Chair Cressy has presented, as well as Director Mulligan's motion for request for more data. We have more specific data. We can tweak our frameworks, and I really hope that these motions will help Toronto Public Health continue to support the recovery of our healthcare system. TPH can't control healthcare partners, can't control institutions, can't control systems, but they can continue to support our most vulnerable patients, and in doing so, it will help our healthcare system recover. It'll certainly help health providers like myself and Dr. Wong have the supports we need to support patients who need help the most. Thank you.
Thank you, Director. Just before we go to other speakers on this item, we're just approaching 12:30. I would like to place a motion that we move to complete the agenda, as we're just about done this item and we have one item after with no presentation. So to our clerks, if that could be placed on the screen, move to complete the agenda, extend past the recess in order to complete the agenda.
Through the chair, we can place it on the screen. I can also just take it as that you have placed that motion and you can take the vote on it. That might be faster.
No, that's fine. So on the Willow Committee, all those in favor to move to complete the agenda for the final item following this? Any opposed? None, that carries. Thank you. So thank you, Director Bowery. Any other speakers on this item? Okay, with that, we'll move in then to vote on it. We have two items here. So the first is item HL 36.1. Can we take the motions as a package, the motions that I moved along with the motion moved by Director Mulligan, seeing concurrence with that. So as a package, the item as amended, all those in favor? Any opposed? Seeing none, that carries. And then item HL 36.2, this is the COVID Equity Action Plan. There was a motion with two amendments placed. All those in favor for item as amended? Any opposed? Seeing none, that carries. That then takes us, now that with the formal item, to extend to our final item on today's agenda, which is the health impacts of the COVID-19 pandemic on children and youth, item HL 36.3. We have one registered public speaker on this item. There is no presentation, so we'll hear from the public speaker and then move it into committee for questions. Is it Eleanor Ray who is connected on the line? Do we have Eleanor here?
Hello, this is
turn it to Nahom. Oh, sorry, go ahead.
This is the host to Eleanor Ray. You are currently unmuted. Can you say a few words, please?
Eleanor, we have you connected. Do you want to, are you there? Okay, we'll do a final call. And Eleanor, do we have Eleanor Ray connected?
Can you hear me on the line there?
Oh, yeah. Wonderful. Eleanor,
Hello.
we hear you loud and clear. Thank you for joining us and for being so patient as we've dealt with other items all morning. Eleanor, you'll have 5 minutes, and you can begin whenever you're ready. And I'll give you a heads up at about the 30-second mark, just so you have a sense of the clock. But when you're ready, we'll turn it over to you.
Okay, great. Thanks so much. It's good to be here. As an organization who's been studying the secondary impacts of COVID on children and youth since the spring of 2020, at the beginning of the pandemic, we just wanted to express our strong support for recommendations 1 and 2, and specifically highlight that the impacts have been very varied and uneven, that there is a need for more data to understand all of these impacts, that there's a need to work in partnership with education stakeholders to address these impacts with a view on long-term recovery as opposed to Band-Aid solutions. Our data speaks very strongly and consistently to physical activity and play as protective behaviors for children and youth's emotional health. Unfortunately, very few Ontario children and even fewer youth met activity guidelines during the pandemic based on what we know so far. Any recovery strategy should have physical activity and play as pillars. So I'd like to just share 5 key findings from our most recent report from Maximum City, which was submitted to the board. Fewer than 1 in 10 children, which are ages 5 to 11, and 1 in 20 youth, ages 12 to 17, met the combined recommendations for physical activity and outdoor play. There's a consistent correlation between greater reporting of negative emotions and not meeting the recommendations for physical activity and outdoor play. There's also a consistent correlation between in-person school and higher rates of meeting the recommendations for physical activity and outdoor play. There's a correlation between greater reporting of healthy growth or no weight change and meeting the recommendations for physical activity and outdoor play. Nearly 3/4 of parents or caregivers reported that the pandemic has negatively impacted their child's mental and emotional health, while more than 4 in 5 report recent feelings of happiness in their children as well. We believe that resources and investment should focus on those who are hardest hit, which includes, based on our research, those with pre-existing challenges or inequities, those who live in apartments, which as many of you know is nearly half of the City of Toronto, those who spent the most time in remote schooling, as well as older kids and teenagers who have worse outcomes based on our findings. Finally, I'd just like to thank the board for all their work during the pandemic, and specifically outgoing Chair Cressy for his many years of public service. That's it for me today.
Thank you very much, Eleanor, and thank you for joining us. Let me open it up to members of the board. Are there any questions for Eleanor? Seeing none, Eleanor, thank you very much for joining us here at the board today.
Thank you.
We'll then move this. We're into committee questions for staff. Trustee Donaldson, why don't you kick us off?
Thanks, Chair. So just to pick up on what Director Bowery was speaking about before in terms of backlog issues. So it strikes me at this point, we may be working on 3 different tracks in terms of working on a backlog. In this case, of this report specifically around dental services and around vaccines for preventable diseases. So there's the backlog, then there's the planned recovery efforts that we have in place, and then there's the continuing to address COVID-19. So I am growing more and more concerned about how much we are spreading ourselves thin, and how much we don't have the resource. We potentially don't have the resources. So, Dr. Davila, do you have any concerns about resources related to backlogs specifically in terms of services for children and youth?
So through the chair, Trustee Donaldson, I always have concerns about resources at the best of times, and I would suggest to you that I have increased concerns, given how much Toronto Public Health as an organization has been through over the course of the last 2+ years. And I don't mean to be doom and gloom about that. I'm just trying to be realistic about that which is in front of us. And I think that we have, again, a number of different circumstances changing. I think about the recent federal announcement in respect of dental care. We don't know how that might alleviate some of the burden on us. Still, I suppose, TBD at this point. But we are working right now, as Councillor Cressy alluded to in some of his earlier comments, on incorporating within our COVID-19 response other integrated services, if you will. I think we're trying to incorporate aspects of our work that have had to take a bit of a back burner in the work that we're doing. So offering the school immunization program vaccines as part and parcel of our COVID vaccine clinics, providing some degree of dental service also within the context of our vaccination efforts. But you're quite right. We are really focusing, as in this report, as trying to articulate in this report, looking at those areas that matter the most and focusing our resources where we know we can have the greatest impact in terms of addressing the issues that are driving health or health inequities in the greatest way at this point in time. So we'll continue to keep this board informed as to our efforts in this regard, and we'll seek to use our resources as responsibly as we can, with the goal of having the maximum impact and the maximum benefit for the people we serve.
Thanks. Just one further question. One of the recommendations is the Board of Health requests the Province of Ontario to provide resourcing to address the service backlog, specifically with dental screening and school immunization. So if that resourcing does not materialize, can you give us an idea of what the impact is on those two programs in children and youth specifically? Thanks.
So through the chair, Trustee Donaldson, I don't know that I can give you something specific, but perhaps what I can do is undertake to the board that if for some reason we're not getting the resources that we think are necessary and we see an issue, we will come back to the board in respect of what it is that we're seeing and what we would propose by way of a path forward to address issues and needs that are being experienced by children and youth in our community.
Thank you.
Thank you.
Other members of the board, anybody else with questions on this item? Okay, we'll move it into committee for speakers. To speak on this item. Trustee Donaldson.
Thanks. Through the chair. First of all, thank you so much to Toronto Public Health for this report, and also to our delegate Maximum City for all the work that they've done related to children and youth. So as a school trustee, I've seen firsthand the needs of our children and youth, and I'm growing more and more concerned by the day that there isn't more of a focused policy and resource lens on our children and youth. So I think this report is a good start. I think a lot of folks have probably seen a lot of the data that the TDSB, the Toronto District School Board, has also released, specifically on the impact of prolonged school closures and increased remote learning that have resulted in some serious consequences for many youth. TDSB student data also shows concerning declines in self-reported mental health status for students over each of the 3 years of the school year, of the pandemic. And there's also been in our schools a recent increase in the use of 20-day suspensions, and that points to a lot more serious and sometimes violent incidents in our schools. I think our kids have carried a great burden these last couple of years in terms of helping to ensure the health and safety of all of us, and I think it's time for all of us in all jurisdictions to really get laser focused on our youngest citizens. So I have a couple of additional motions to add. The first is that the Board of Health forward this report to our federal partners, specifically the Minister of Families, Children and Social Development. And the second one is that the Board of Health requests the medical officer to continue, please, to provide further updates on the pandemic impacts on children and youth as they become available. The ALPHA, the Association of Local Public Health Agencies, has also indicated their concern about public health services for children and youth, as well as what we just heard from Director Bowery. So please, everyone, continue to be a voice for our children and youth in this city. They need it. And finally, I just want to say all the best to Chair Cressy. He has been an incredible leader and an incredible chair, and we'll miss him beyond measure. Thanks.
Thank you kindly, Trustee Donaldson. Any others to speak on this item? If I could put myself on the list then, just a few words. First of all, a tremendous thank you to the team at Toronto Public Health, and I'll single out Nicole Welch in particular for their work in pulling together this report. This was a request of our board to bring this forward, and I think it's incredibly timely and important. Listen, this report in detail outlines that while there were necessary measures with intended consequences implemented around school disruptions, intended consequences being to address the harms of COVID and limit transmission, especially in earlier waves, there were unintended consequences that cannot be ignored. The health and well-being of children and our youth in this city has taken a real hit in these last couple difficult years. The report delves into the details. Anxiety's up, PTSD is up, emergency room visits for self-harm are up. Physical activity and access to healthy food is down. Access to dental services is down. The number of lapsed student immunization program shots for not COVID vaccines, but others, is significant. And of course, as the report notes, many of these consequences have been disproportionately felt by children and youth in our city who were struggling before in marginalized settings and communities. And so why this is so timely, I mean, partially, in part, it's to have a honest conversation about what some of the unintended consequences were so that we can better address them going forward. But to me, one of the most important recommendations in front of us is to build this baseline indicator of children and youth health and well-being in our city, a baseline indicator so that we can guide on a go-forward basis, whether it's dealing with future waves of COVID or whether it's dealing with other situations, to have a baseline that we can use to assess the health and well-being of our children and youth, and to use that baseline to inform potential future measures in the context of this pandemic. Remember the old adage, last to close and first to open? Well, that is a real adage because the unintended consequences are real. But it's also, this work is necessary to accelerate our programs to catch up, as we're doing now, whether it's dental programs or student vaccine programs. That it was announced this morning, I saw that Toronto Public Health is now running vaccine clinics in schools every week starting this week to catch up on regular student immunization programs, but also to work with school boards for enhanced supports on a go-forward basis. We've always said through this pandemic that our task was not just to beat this pandemic, but to build a new and better normal afterwards. For children and youth, that must be so. And to do them right after all of the sacrifices children and youth have made, we have to do better. And so this report sets us on that path. With that, thank you once again. I believe we have the amendments moved by Trustee Donaldson. So why don't we vote on those first? All those in favor of the amendments moved by Trustee Donaldson? Any opposed? Seeing none. And then the staff recommendations. All those in favor? Any opposed? Seeing none. An item as amended. Altogether, all those in favor? Any opposed? Seeing none. Colleagues, that takes us to the conclusion of this agenda. It is with immense and heartfelt gratitude that I thank you all for having the privilege to have served alongside each and every one of you. And as I've done the last number of meetings, to Dr. DeVille and the team at Public Health, carry on. We need you. We love you. We appreciate you. We see some hearts coming from our members. That is a sincere feeling we all share. So to our doctor, to E, and to all our staff, to our 2,600 team-strong team at Toronto Public Health, we admire you with everything we've got. Keep up the hard work. Thank you kindly. That concludes our meeting.